first item on the agenda is the reorganization of the board.
I would like to make a motion that can we move the first agenda item to after the executive session?
I'll second.
Discussion. I've never heard of reorganizing the board at the end of a meeting. It's usually done at the beginning.
Well,
You guys wanted this.
does that, I understand, does that change the chair for this meeting? So that is why.
Yeah, why do you want me to chair this meeting?
Well, for one, you put the,
I'm here. I'm going to be part of the meeting. I can help.
but as the chair, you put the executive session on here. You also did not state what it was or what it was for, and I don't, or Kim, whoever it will be, to be part of that, so that's why.
All right, well, you get a motion, and I can make a motion to go into executive session.
Okay, well, I still stand with my motion.
Okay.
Do you have
I mean, there's a lot of things on the agenda for tonight. I don't know why we can't put it at the end of the meeting.
I'd like to talk a little bit about the topic before we vote. I'm very happy that, you guys both asked to reorg the board. I agreed to serve as chair. I hadn't intended to remain in the role this long, and actually right now, as my personal and professional responsibilities are increasing, this just feels like the right time to step aside and allow you to take it over. So I think it's really great. I've done my best to fulfill the role responsibly and in accordance with the public health principles. And the only problem I have is the concerns I have around the conflicts of interest that you have and I think you have with matters that come before this board. So at our last meeting, you had
Yeah, but why are we still discussing this? Can't we do this at
because
the
it's in
end?
discussion to move the thing. Can't we? Why do it at the end so that I got to let you know what my
Well, the motion is to move it at the end. I hear everything that you want to discuss regarding the topic, but the motion is on the table to move the whole line item to the end.
Okay, but.
And I made the motion, she seconded it.
This before.
Yep, I've spoke to ethics today, actually.
Good.
Yep,
All right.
so,
All in favor?
aye.
Aye.
No.
Okay.
Next topic is the Massachusetts Association of Health Boards Public Health Training Recommendations and Certificate Program Registration. I gave you in your packet an email a couple of emails from Mike Hugo from MAHB, where he notes that the training certificate program is up for registration right now. So if you want to go attend the certificate, I would recommend that you do that. Sign up for one of the 4 dates that they have posted. And the other piece that I put in there was the duties of local boards of health in Massachusetts, just as a refresher, so that you guys know what the duties are. And that's all I had on that topic. Do you have anything that you want to add to that or discuss?
Nope, I have to read through all this, so.
Michelle, I think the cost for the certificate program is waived for the members of the PhD.
Correct.
Mm-hmm.
That is correct.
So it won't cost you
Couple
anything.
people. Yeah.
Just at the register,
Yep.
pick one that you want to go to.
Mm-hmm.
Are we allowed to attend the same one? Like if
You
there's...
can, but you just have to be careful you don't break the open meeting law during the
Right.
discussions.
Okay.
What did you say, PHE?
Yeah,
Public health excellence.
health excellence grant. Mary Lane Hospital, discussion regarding coalition opportunity with Healthy Quabog Urgent Care Services. Is Cynthia or anybody from Healthy Quabog here? So I got a bunch of emails. I didn't make copies, but it was email originally came, I think it was from Karen, because Karen from the select board, she got a request for select board and maybe somebody from Board of Health or just a couple of people in town to attend a meeting that they were having with the rural health, the state. I didn't know much about what it was discussing. I'm not familiar with the Mary Lane closure issue and things like that. So I had said that I would go to the meeting and let Karen know. I never got an invite for the meeting though, so I didn't know exactly where or when it would be. I did put a note in my phone for myself, but I put it in for the wrong day. And then,
Can I ask you a quick question on the agenda?
I'm sorry, yes.
Can I ask you a quick question
Sure.
on the agenda? Because I'm on the agenda today too, and that's for the Rural Health Collaborative.
Yeah, that's
Is
next.
that different? Oh, it's next. Okay,
Yep.
I'm just making sure.
I think so.
Thank you.
Okay, and so there was a meeting. I didn't go. I don't think anyone from the select board went. And at that meeting, I think it was decided that they wanted to create a coalition of area towns to work on this issue. So the emails kind of went back and forth, and I said several times in the chain of the emails that I'd take the issue up this month with the board, and then you can decide if one of you wants to join that coalition and go to meetings and whatnot. So I thought that person might be here to talk about it because they referenced wanting to get on the agenda. So I don't know much about it yet. I can give you the minutes. Find them. They did like a quick minutes. Leave that copy.
There you go.
Sorry, you gotta speak into the microphone.
Do you want a copy?
Sure. I don't know anything about it.
I don't either.
I don't either.
I don't know when they would be meeting or
I don't know.
how often.
I think they're just, I was gonna find out tonight if anybody wanted to be involved in it and then get back to them, and I would imagine that person would reach out to whoever that individual is. I think they're limited for seating and things like that at these meetings, and there's quite a few towns involved.
Oh.
It has to do with, I think my understanding is creating an urgent care or finding funding to have urgent care in the area because of the loss of Mary Lane Hospital. And so they're just concerned about, rural health options being, diminished because of that closure.
Okay.
That was my understanding of it, but I haven't gone to any of the, I didn't go to that meeting and I haven't heard anything since, so.
They did just put an urgent care in Sturbridge, but
I did
that's,
mention that to them, actually, that a lot
Yeah.
of our residents probably would go there.
yeah, but this is more referencing Hardware, New Braintree, Warren, Belchertown, so it's out
Yeah.
west.
Healthy Quabog, I think, does kind of cover Brookfields, so they wanted to include, probably wanted to get as much momentum as possible across the central Mass region.
So they're really just looking for us to get on board and,
Yeah, if somebody wants to be part of the coalition, go to meetings, help drive the initiative. But it's very early. I think they just got together and sort of decided to create this coalition, so
Okay.
I don't know any other detail around it.
Okay.
So does anyone want to?
No, I want to like read more about it.
I guess if she wanted to be on the agenda and she's not here, maybe she would request next month to be on the agenda.
I can
And any
reach out and
correspondence.
just say that you guys need to think about it some more.
Yeah.
Get some more information, and I'll leave your contact information.
Sure.
Yeah, I could go to the clerk's email and they can disperse.
Anything else on that one? All right, so the third topic is Friends of Mary Lane Hospital, I'm sorry, the fourth topic, that one. Hardwick Board of Health UMass Initiative through the Rural Health Transformation Program. Are you Judy?
Yeah.
Hi Judy, come on
Hello,
up.
thank you. And I'll get some copy
Maybe
of this.
that seat over there with the microphone.
That seat over there.
Yeah.
Do you want me to give you one copy of those so you can, you know? Okay, I can actually clarify a little bit of Cynthia as well. Where, as you know, was fighting the Mary Lane situation, and they're trying to figure out how to get an urgent care into where. This is not that. But I do support her efforts, and I do go to her meetings, so, but this is different. So something super important happened in healthcare in the last 6 months, and that was $50 billion through the Rural Transformation. Are you familiar with this at all?
A little bit.
The Rural Health Transformation Program, there was $50 billion through the big beautiful bill was allocated to rural health. It was $10 billion over 5 years, 10, 10, 10, 10. Each state had to submit by the end of last year their plan on rural health and what were the towns that were eligible for rural health and what was their big program. And if you actually go out on mass.gov, you could actually see their application. It's out there. So they submitted these towns and clusters and various other things. And as you can imagine, anything west is rural, definitely down the central, and then a little bit on the east. So let's start with that. And then what happened is once Massachusetts put that in, they were allocated $162 million for 2026. So I'm giving you the high level here. $162 million for 2026. The rural health DHS actually has to allocate that by September 30th of 2026. So what they're doing is, as you can imagine, a lot of folks are trying to figure out, well, can I put my application in and get part of this money? Well, one of the biggest entities, there's two big entities going for this money, Bay State, UMass. So I want to talk a little bit about that today. All right? So they have to put an application in now to get their portion of that $162 million. They not only have to put the application in, they have to implement something by the end of the year. So next year, they can reapply and get that next chunk of grant. Do you see how that works? Mm-hmm. So if they don't have something kind of going and something working, when the state goes back up for trying to get part of that $10 billion for this next round, if they're not doing anything, the government's going to go, well, you know, you're not doing anything. So the other states will probably get a lion's share. So the name of the game for the health entities in Massachusetts is to try to figure out how to get something rolling in 2026, which is kind of a rush year versus the 4 additional years, which you have a little bit more time to plan. So why I'm here today. Gave you the thing. You're like, so what does that mean to us? What it means to us is I'm actually working with UMass. And UMass, we have put a proposal in front of UMass. And initially we put a proposal in front of UMass for only 6 towns. We chose the 6 towns as a cluster to build out specific programs that were built around the Rural Health Initiative because it just seemed a little bit more convenient. But UMass actually asked us to include the Brookfields. So you are now part of that because, and the one you have in front of you, it actually used to be 6 towns, now it's 9. So we had West Brookfield, but now East Brookfield and North are now included as a request from UMass. Okay, so understanding what the Rural Health Transformation Program has to be, it's trying to build the rails for true rural health, meaning anything that they put in place is not billable today, but you're trying to build an infrastructure that will be billable in the future to health systems and health plans. No out-of-pocket to towns. This is not out-of-pocket. This is truly trying to put rural health care in place. And I know you don't have a copy of this, but I'll read a couple of things. I know, I'm sorry.
That's okay. That's what I was looking for.
I should have done 5
That's
copies.
okay.
So a couple of the programs that they are most interested in, let me tell you a little bit about UMass and why they're interested. Last year, they broke a ribbon on a 20,000 square foot facility out of UMass just for rural health. It has telemedicine, remote health, telepharmacy, rapid response. Let me talk about what rapid response is. You have a 911 call, it shoots over because it's a toenail or a fall. They put a rapid response unit instead of sending your ambulances out to every single call. So there's multiple programs that we've developed over the years for rural health across the country, and they're really at the top of their game on this. What they're trying to do is take a section of what Massachusetts determined to be rural R1, what we call risk level 1, rural 2, which you fall into. You're 1, Hardwick's a 2. And pull these programs together so you could be the blueprint for what Massachusetts will do as true rural health. And rural health means we can do RPM, remote patient monitoring, we can figure out when patients leave the hospital, get ahead of them and do medication reconciliation. What you're trying to do is take care of people that can't get to PCPs, don't have PCPs. I mean, I could sit here forever. I'm a healthcare executive, so I happen to live in a farm in Hardwick, but my real life prior was in this industry. So it's really a tremendous opportunity, and we brought these 9 towns together. You are actually my 7th that I've had this presentation with. And we're not just looking to say, yeah, nod, we'll do this, but really embrace it and really think, would this be good for the community? And is this something you want to get involved with? Obviously, UMass is going to be going after a huge chunk of that money. Probably about 30 to 40% of that chunk of money they will be going after for 2026. And if they have proven outcomes and do their programs, they will then obviously push further as 27, 28, 29, 30. Name of the game again is, and I know this being a healthcare industry person, we start and we really understand that we have to ramp slowly, figure out programs that work right away, because engagement and changing behavior is really difficult. So you have to really work through these programs. But we have never had the support in rural. I mean, I live on a farm, and I live every day wondering if my husband's going to fall off that tractor, and I'm not going to have an ambulance, I'm not going to have anything. So we all live that, right? So this is kind of near and dear to my heart because this is what I've been doing my entire life in my own industry and my own companies. When I ran companies in healthcare, and I was actually executive for CVS Health as well, so, and IBM Healthcare. So this has been really passionate thing for me. So the opportunity when this money came forward and UMass came forward and the CEO, Eric Dixon, came forward and said, we want to work with you. I'm having goosebumps to watch that. It was super exciting that we could be the first cluster that was able to work with UMass directly and try to develop this plan. So my ask tonight is not necessarily, you can have a copy of this, have a lot more materials, trust me. I was just like reorganizing tonight. I was like, oh my God, so many papers. Do you want to be part of this? Is it something that you don't have to say tonight necessarily? I have another call with Dr. Eric Dixon, which is the CEO, the AVP of the entire rural health program, and a bunch of others. They're head of their EMS, et cetera, on Monday, so we'll have more information on Monday. But what I wanted to make sure is the Board of Health and my partner, who's Dr. Neil Halen, we want to make sure the boards of health were the ones leading this initiative through the towns. It's not a select board initiative, this is a Board of Health initiative, and we want to make sure you knew what was coming. And again, how this differs from what's going on and where they're trying to fight, that's a Bay State issue. I don't want anything to do with that. It's another county, another Bay State issue, and they're fighting Mary Lane and during urgent care. This is a shovel-ready type situation where maybe our first programs are we're delivering medications to those folks that can't get out of their house, whatever it may be. Their programs are in here, you can see them. But build up and over the course of 5 years have a true rural health model that actually works for people like us that have limited access. Note that your Sturbridge, your urgent care, Harrington, those are Harrington's UMass, and so is obviously UMass. We have Barry. Barry is actually their training ground for a lot of early physicians. So what we're tying together infrastructure, but the way that this grant works is it has to be innovative, not billable today. You got to think outside of the box. You got to work with your EMS. We got to work with, it's going to be working with all the people to figure out how, if we could dream the dream, how would this work best and get those rails in place and make sure it's doable in the future. Any questions? Does that make sense?
Mm-hmm. How did you get involved with this?
Dragging and kicking. No, I'm just kidding. I've been actually working in this for a long time, and Hardwick, we've been trying to figure out kind of a rural health model, but you need funding to do this stuff. So we kind of dabbled along. As soon as the Rural Health Transformation Program was approved and funded, I immediately made calls out to core people here in Massachusetts. And obviously my buddies across the country is like, what are you guys doing? What are you guys doing? It was super important to make that call directly to Dr. Eric Dixon and say, listen, what are you guys doing? Because we're in Worcester County, and that is a big deal for this. I don't have that specific map in there, but if you look at the state, the clusters, Maura Healy or whoever's group did these clusters, and we fit in this perfect little cluster right in the center on the western side of Worcester, moving into where UMass is, right? So that was a prime territory. Obviously, they're going to go south, but we want them to prove the model with our 9 towns, and then they can go north, and if they were smart, which I'm pretty sure they are, they'll be talking to Hayward. Are you familiar with them? They're in Athol. They're an independent rural hospital. They'll probably be talking with them to try to pull that into the rural model. Bay State is probably going to go for their own funds and try to figure out how to do their rural model over there. So you're almost going to have some competing models, I think, when it comes through. But I think UMass has a big step ahead on this one. If their whole digital, 20,000 foot facility, they already do rapid response teams, EMS. They know how to do this already. The other thing is, I don't know if you guys understand how hospitals and quality measures work. but UMass is a 4-star, which means it's a high-quality CMS-rated Medicare, Medicaid entity. Bay State's a 1-star. So we really needed to make sure that our people were affiliated with the hospital that had quality ratings. That's where you want to be. You don't want to be on the side that doesn't. So I was kind of pretty happy we're on the Worcester side. But that was just fortuitous, probably. Does that make sense?
Yeah. So this might be a dumb question, but
No dumb
what
questions.
is their plan for like communicating these programs and services to people? And because I
No,
feel
no, no,
like-
this gets a lot more fun. So
Okay.
if they agree, I mean, if everybody agrees and let's say it was these 5 programs, just let's say, and you don't see them. But let's just say it was a telepharmacy thing. There is no communicating. This is collaboration. So the boards of health of all 9 towns would work together and figure out, okay, what does the right program look like? How do we work with UMass on this program? Who's going to be the key collaborator, whether they have to hire it in for your town or our towns, or we have somebody that raise their hand and, be that position, to get the folks on board, do town halls, do whatever it takes, communications. Remember what I said about adoption and engagement? All that has to be done. But the very first steps are working groups quickly on how would this work best. And because again, these are all unbillable services, you kind of start a little high and you work to what's reasonable, right? And that's kind of how these things work. We work a lot of programs in what we call demonstration projects in the government and with healthcare, where we try models. This is similar to that, except this is totally funded. Don't worry, it's not going to be do this. It's going to be, what do we do?
Okay.
So the board's involved. That's why the Board of Health is being included in this is, who do you want to have involved that actually sits down and says, okay, how do we make this program actually work for our town, our environment? I will tell you that Warren, they were all over. We're like, well, we have people on bicycles that even deliver drugs. It's like, well, okay, well, that's a little odd, but we'll go with it. Didn't say that to them, but that's odd. But that was them filling a gap. This is where you can actually have a program that is going to be sustainable over time. And that's what you're aiming for here. That's what this is all about. This is not about a short-lived 5-year project. At the end of 5 years, we better have something totally sustainable. Barry asked an interesting question. He said, what if there's a program we really, really love, but it never showed the outcomes that people wanted, it couldn't get it billable, and it's like, well, the town then has a decision, either drop it or, find a way to get it funded. But, if we do our job right, that's not going to happen, so.
Okay.
I'm sorry, a long answer to that very simple question, sorry. That was a complex question.
Yeah, but I think like you explained it, there's some steps before
Lots
that
of
answers
steps. Mm-hmm.
what my question is.
This is, do you want to be part of it or even, be part of the loop of, you don't have to say, yeah, I want to be in it. This is the point of, is this interesting enough to, talk to UMass comes back and they say, have someone at the table and say, yep, we want to learn more and figure out if we can get this done. That's all it is.
Oh, yeah. I
I'm
think we share
interested.
EMS with West Brookfield now, so I think this is gonna be very important for the townspeople. I think that's great
Yeah.
what you guys are doing.
Thank you, yeah.
It's a lot of work.
It is a
Yeah,
lot of
I can
work.
tell, yeah.
It's a lot.
Yeah,
Yeah, my face is turning red. It's a lot. It's been
Yeah.
a lot,
yeah.
but it's
So
worth it.
this is your passion. This isn't necessarily a job.
Exactly.
Okay, God bless you. Because I also have a farm and I don't know, like.
Yeah,
Okay.
if I hadn't had a career, from day
Yeah.
one in healthcare, I probably wouldn't have that passion. But even my husband looks at me and goes, "So this is your passion, Judy." I'm like, "You got to be kidding me." I will be full disclosure. My husband did fall off a loft, and it was an hour before they picked him up, the pieces, and he was airlifted, and you know, it was 50-50 for about a month. So I understand how it feels to be stuck in that situation, and that was not a great situation. Finally, when somebody showed up, I was literally like screaming in my front yard going, what took so long? I mean, I was just,
Yeah. I guess
Yeah.
I'm curious too, what some of the the programs. and
oh,
stuff,
yeah,
like-
okay, I can read them to you. You'll have them. Let me read them to you real quickly. So the lightest level ones are telepharmacy, which is, okay, so what you're looking at, great room for this, by the way, that would be where you have, since we don't have a lot of pharmacies around here, it has the ability to deliver those medications to a central location, deliver, and then have a telepharmacist or somebody go out and actually work with those folks, the high-risk patients, in order to understand what the medications are and make sure they get them. So that's a low-level one. The highest level one is that triage I talked about, where you're taking the 911 and you're doing a split. They've done this before. This is a model UMass uses, where 911 calls are coming in when it's actually validated an ambulance needs to go out versus a rapid response, which does other things. Maybe you have a broken arm, you just need to have it set, we need to get in, whatever it may be, you know, little things. You fall, which we have a lot of those people in our town that just fall, and we have to send an ambulance out for a fall, those kind of things, so it clears that out. The other one that it also shoots through is behavioral health, because a lot of our cops are set out on behavioral health calls, versus regular calls. And so you have this behavioral health unit that can actually take care of that. So that's the most dramatic. Then you have the complex patients. So the patients that are identified as most complex in the community are given, those are the comorbidities and those that are frequent flyers, folks like that. You're actually going through a program, whether it's through RPM or just regular ongoing navigator calls, that kind of thing. It's those types of programs. So there's 5 different ones here. I went kind of the gamut from the higher to the lower lift, knowing that we could probably hit 2 of those programs 2026, and the rest would have to be like 2027, 2028. Far more complex, a lot more people you have to work with, EMS and all these other people. So what we bring to them, by the way, so you're wondering, why didn't UMass even say, you guys didn't ask that, but why did UMass even want to work with us? Because I don't know how many people are executives in this room, but you're sitting around a table and you're like, oh, we can do this rural health, we got this thing, we put out this proposal, we can do this. And then they sit back and they go, well, how do we get started? We don't know anything about small towns. They know nothing about that. So what we want to bring to them is a unit that says, no, we know small towns and we can get this done because we want this here. And we're going to help you facilitate that in our world, which is very different than their world. So that's a big deal to them because they don't have those people. Those are not the people that are sitting around that table, I guarantee it.
Are there going to be surveys and stuff to go?
Oh,
out
yeah,
to people?
exactly. That's what, exactly. We'll sit around and say, what's the
Okay.
most important thing to do? Should we put out a survey and say, what are the most whatever, or, you know, who's most at risk? I mean, there's a lot of
So
different
this
thing
is
we
really
can do.
just, are we interested to be involved?
Great. It was an easy ask. Yeah, just
Yeah.
wanted, on Monday, then I could say yes, but I would love for you guys to be included. So they asked again for the Brookfields to be included, so.
Okay.
I think this is a no-brainer, we want to be involved, right?
Yeah,
Yeah.
absolutely.
It's actually going to be, it's going to be a lot of work, but it's going to be a lot of fun. And you know what? My challenge to UMass is you better build the best rural model in the country so it can be replicated, right? This is not about, something that's a short-term thing. We better build a good one, so. All right.
Wow, very cool.
Excellent.
So, thank you for your time tonight. You can have a second copy.
I'm sorry, what was your first name again? It's just
Judy.
Oh, Judy, okay, it's just on here as Jay, so I just wanted to make. Thank you very much, Judy.
Thank you.
Appreciate
Thanks
it.
for your time.
Thank you.
Make a copy before the end.
Yeah, please.
the Leicester Regional Public Health Coalition. First item is inspectional and permitting report for the month of January.
Yes. Good evening, everyone. I wanted to say we did a couple permits issued this past month in January. We did, I'm trying to think, sorry. Couple retail, so Tip Top Co-op, Babes Lawn Care, Septic Hauler.
Sorry, do we have a copy of this anywhere?
No, I didn't send the copy.
Okay.
I do have I have copies, printed copies. There you go. Of course. As I was saying, we did some permits. Food, whether it was food, septic, annual permits, tobacco, mobile home park, and mobile food permits. We got a new construction application that's under review for 9 Tupelo Drive, and we issued a certificate of compliance on January 22nd for 80 Lake Road, Oakham Farm. Then we did a couple inspections as well. I don't know why it shows food reinspection or housing inspection for Cumberland Farms, but that should be a food inspection for Cumberland Farms. We did a site visit, couple site visits for Oakham Farm State, 53 South Maple Street, and Wildberry Acres Farm. And the reportable disease activity, do you want me to say that aloud as well?
Yes, please.
We had 8 confirmed cases for influenza, 5 confirmed cases for coronavirus, and 1 probable for Lyme disease.
And just quick to go through the permits themselves. We usually list out who got permitted, so.
Just the approvals, yep.
Yeah, so Tip Top Co-op for retail food.
Yep.
Babes Lawn Care for septic trash hauler. Wildberry Acres Farm for their annual food establishment permit. Dumont Septic Pumping for a septic trash hauler. Big Path Spirits for tobacco. Almond Sun Septic for trash septic hauler. Wagon Wheel Community Incorporated for their mobile home park permit. And Char Cut to Go for mobile food permit.
Correct.
How come the approval dates aren't in chronological order?
I don't know. So usually we have, I should have put it in chronological order.
Oh, okay.
Yeah.
Okay.
It's just a matter of whenever we approve, and then it's on the spreadsheet. So I
Okay.
just copy and paste it, and I should have just put in a chronological order.
Okay.
I'll put that for next month.
Thank you.
Mhm.
And then we go to Christina and Kim. You wanted to discuss communication, the health director, regional health agent, the administrators, assistant roles, review plans, policies, and procedures.
All right, well, start with request to discuss communication. I was requesting to have this on there because I don't feel like it's been consistent at all with the transparency of what is shared, what isn't, and with who and with not. So I wanted to bring it up so that we could, moving forward, make sure that, Michelle, you did really good recently with putting letters that you had put out, but actually my question, is it just for food reports or should it be everything?
For what?
That like, when you send out a letter to a business or like a violation for anything, shouldn't we be seeing all of those?
You mean like an order to correct letter when we do any housing inspections?
Yeah,
or-
like anything, like, shouldn't it go to all of them go to all board members, not just?
So from my understanding, we used to just send to the Board of Health, the clerk,
Yeah.
or the Board of Health email, and then the clerk, since there was no clerk, I think originally it was sent to the Board of Health email and then Maureen, or the chair.
Yeah, I just feel like it hasn't been consistent for like what is shared, what isn't. And I understand that, as far as what I understand is it can be factual information, reports, data, as long as we don't discuss, deliberate, or give any opinions. I guess I want to see the consistency improved, and I don't want to make sure I don't bring any, so administrative roles,
Can we just keep going, communication? I think
it's
one
all
of the,
gonna kind of tie, but,
one of the points I think would help too is, you know, SharePoint's been a thing for a long time in like Outlook or whatever, and there should be a central space where documents can be placed and information can be accessed, that everybody can retrieve it without it all having to be emails that you wait on that get buried in an inbox. Like if we had a SharePoint set up for the coalition
Yeah.
and then people just had access. 'Cause
Yeah.
I don't even get everything all the time either.
Yeah.
Sometimes it is kind of haphazard of where it's going and for what, you know, and
Yeah.
sometimes I'm not even sure, you know, it's supposed to go to us right away because typically we're not involved in the details of the permitting unless it's something that has to come back to the board. So, but a SharePoint would be really useful.
I'm
You know,
absolutely
somebody
open
gets
to
a
that.
call and they want to go find a document, you know, they can just go in and find it.
Of course, I'm very open to have a SharePoint access for the coalition, absolutely. And in terms of, I mean, order to correct letters and things like that, I think in the way it would work and hopefully moving forward, but if any food inspections with the new software that we will be getting, which I don't know if that was signed by you guys, but different topic. With the moving forward, you will have access to that for the food inspections, and not necessarily sending you every single time we do an inspection, so you'd have access to that regardless. When it comes to housing cases, I think it makes sense to send housing cases when they're closed. That way you have one, and then any matters that needs to be brought up to the board, which in the past I believe it has, things have been shared then. But again, if we have like,
not necessarily everything, so that's why, like, I hear some things and it's like, I don't know anything about it,
okay,
so.
That was kind of the point of the monthly
and,
reporting.
yeah, I mean,
is
if-
to
Yeah, but I
update the.
like, not everything, it's like kind of quickly, not all things are shared.
Well,
But
ongoing
some are-
stuff usually, like this report's intended to be for permits issued.
Right, so it doesn't
inspections
have
that were
everything,
conducted.
so, I don't know.
But I mean, like to your point, usually we wouldn't be involved in while something's ongoing.
Right.
If it's like a housing issue or something like that, it's usually left with the agent.
right,
until
unless
it's
you guys want to
completed.
be part of it every single time we send an order to correct, it's up to
Well,
you.
no,
we're
I
open
mean,
for-
like, for example, there's times where, like, I know you've been involved, but we don't know anything about it, so it's not consistent. So I just wanted to bring it up so it is,
Sure, and I'm open to have a fairly communication for everybody, and I think when it was brought up, I did, specifically said, I just don't want to be an issue with open meeting law moving forward.
yeah,
But-
yeah.
But again, if anything specific, like food inspections, that gets shared to the board. If you all want to see that on a timely basis, I can let the inspectors know to send to forward all the food inspections to all you all. However, with the new program, you'll have access to that, so there won't be necessarily emails for that. For any housing-related issues or nuisance, if you want me to send an order to, or every time we send an order to correct, by all means. But I think what would be ideal is to have a shared point, or like a shared drive, so that way you can all have access to it on a timely manner.
Okay,
Yeah, I think that's great, especially like if I'm
'Cause
addressed by
bombarded
a
with
resident
emails,
or
yeah,
something and
yeah.
I have no idea.
Yeah, yeah,
I think it would be helpful just to have some kind of background.
sure. Yeah, I'm open
Yeah,
to have.
usually I just have to forward the message on to Lester, because I don't know either.
Yep.
And then for the files, historically, they're a lot of old paper files, but a good idea would be to try to digitize as much as possible the files and have folders for every, resident, see in town, business, the way they are in these filing cabinets upstairs.
I remember, wasn't that a goal when we got the new printer or
Was
scanner?
Having
I think the scanner
bandwidth,
broke.
and I think we talked
No,
about, like,
this
having
scanner's
Megan do
broken.
that, right?
This scanner's not broken.
Is that the new one that,
The new big one back
yeah.
there?
I don't know, when I got on the board, there was some discussion about a scanner.
Oh, that was for the septic plans, the big one.
That big one's for the plans. It's used for more than one board, but it's right there, so.
She can digitize everything.
Yeah, I mean, anything that's at Lester's getting scanned, and so there's electronics. It's just creating sort of the infrastructure. I think there was a scanning project that happened in Brookfield a couple of years ago, but for some reason they left us off of the list of their, it's before my time on the board, but there was a lot of scanning that happened, but Board of Health documents were not scanned. So, trying to find like a grant or something, a way to maybe pay an intern or something like that, like for a summer project, to do something like that. It might be, something we could investigate, but otherwise it's daunting to try to create that. I was hoping that Jacob or somebody, or Steve from the communications, that they'd have some way of electronically creating folders from some kind of spreadsheet that would just create them for us. I don't know if that's possible or not. I'm not that savvy with that.
Would be helpful.
Yeah.
All right, administrative assistant roles. I feel,
Did you want to wait on, did you have the health agent? Did you?
oh. So, is this the only part? Oh, right here, did I see more somewhere else? Discussing Mackenzie's later. Okay. And Megan is later. So I might
Well,
be
Megan,
good for now.
his full-time job as administrative assistant is at Leicester, right? That's a different job. And then there's clerk.
Okay.
That she's doing, which is separate. And then you don't work at Leicester Coalition anymore, so she's separate. This
Right.
is just under the Leicester topic.
I think I asked about the health agent, because I guess what agents are there? I remember back in the summer, we delegated some because you were on maternity leave. So are they still active agents, or are now you are the agent?
They're still agents. So
Okay.
once agents are appointed, I don't know if you guys.
Our annual report that we just did has everybody's staff and a little background of what.
Yeah,
like what
I
they're
submitted
doing.
that too. So yes, we currently have a contractor called Mike Mendez who does food inspections for the coalition as a support. That's who we hired when I was on maternity leave.
I've
And then,
never heard his name recently.
I've
Mike
never heard that.
Mendez?
yes.
We haven't.
But you guys haven't-
We haven't dealt with
yeah.
him.
Okay. No,
Specifically to the board itself then, it would be Chris Wilson. I don't know why.
And Richard Green?
And Richard Green, and myself.
Who was,
So you are an agent?
Yep,
Oh, and the director?
yep.
Okay. How come,
who was Emily Whitaker Smith?
She is the hub trainer for the Central Mass.
She's the who?
She's the training manager for the public health training hub.
For the training hub, is
So
that?
she was helping
for
out.
the
She was
health
helping out,
Maternity
yep,
leave.
she was
Yeah.
helping out when I went on maternity leave. I requested to have her and Chris to be appointed throughout the coalition.
Yeah,
We
okay,
did that.
that's what I remember doing, but I don't remember ever seeing anything come through with her.
so who
Yeah, she
decides
won't.
like who,
She wouldn't, okay.
what agents go? And is it always gonna be 3 of you showing up at everybody's?
So right now, because the inspectors are being training, I've been going with them. So
Okay.
it's usually 2 of us, or we do have an intern, but they're not appointed, obviously.
Okay.
Sometimes she comes along to learn.
So now, in the past, we always had set up inspections, like mutually agreed upon. Have you guys just shown up at any places without setting up a time?
Yeah, we shouldn't be scheduling food inspections ahead of time because they're open anytime. We can do any inspections at any time where the business is open.
Okay.
So there's you, Christopher Wilson, Richard Green.
And Emily, if
And-
she was appointed, Emily Witter.
Oh,
What
yeah,
you're
but
saying.
I said I haven't seen anything with her name come through. You
Yeah,
said you wouldn't.
she would come to assist. So
Yeah,
if
she's
Chris
like a
Wilson
more
comes,
Advisory.
right, so if Chris is doing the inspection, you'll see his name. If Richard's doing the inspection,
Oh,
you'll
but
see
she
his
might
name.
be there.
Correct.
Okay.
We still have to delegate for her to be able to do,
Yeah.
be there.
I wouldn't expect her name to be in any of the reports, actually.
But you can send interns without us delegating interns.
Because they wouldn't do the inspections, they would just be shadowing.
Okay.
It's like if you were to hire an intern and they're shadowing people, but not necessarily doing the inspection.
Okay. Sorry, there's just a lot of names.
No, understand.
Um, I'm not sure if what else I want to discuss is for this line or not. Did you,
No, but I think Mackenzie, discussing Mackenzie is far down in the agenda. I think it should be in the same section. While we're talking about agents.
I guess we can come back.
Okay.
So I guess things are different now. So maybe, I don't know, did you put policies and procedures?
Yeah, I was just confused how, like, sometimes I get on communications in my email about things and sometimes I don't. So I guess you explained some of it earlier, about just trying to make sure we're all getting, like, food inspections or, you know, that, but,
So if the board, again, if the board wants to receive all correspondence, then that's okay. It's up to what you guys want. My understanding was we would send specifically just to the board of, the main Board of
Kim-
Health email.
Kim, you were delegated as the advisory board contact. Are you getting those communications?
yeah, I am. I haven't attended the meetings because I have other
I know. We've
things
been
going
missing-
on, yeah.
we're missing Brookfield, yeah.
Yeah, it's, I have a conflict that's the same exact day every time.
Bummer, okay.
Yep,
But you get those emails though?
Yep.
Okay.
yep, I get those ones.
Is Maureen the backup? Like, could she go instead if you can't
Yeah,
go?
she's the backup.
I try. Yeah. I don't get to go to everyone either. Sometimes they're just an hour I can't go, but I've gone to some.
Yeah, some of them were in person, but most of the time they're now.
The majority has
I
been
think there
on
was
Zoom.
one recently. I got some email today. of
Yeah,
the
we
meeting
actually
starting,
have
but
our next meeting next,
yesterday.
yeah, we have our meeting next Tuesday at 6. It's Zoom.
Did anyone from Brookfield because you guys made another subcommittee?
For opioid,
Yeah, for the opioid, is
nobody
that?
has shown. For Brookfield.
Okay. And then, so I guess this kind of goes along the same thing with the policies and procedures, because I don't think it's anywhere else on here. There was something that came in the email about the opioid funding, and that it needed to be decided on and sent by yesterday.
Yeah, so we got approved by, we actually applied for the RISE grant,
Yeah.
like last November, and awardees were submitted last month, or last week, I
Are
should
you
say.
loud enough in the mic?
And,
Okay.
sorry, let me get closer. And so we were awarded one of the awardees for those, and they did request to have letter of commitments sent out from the communities that were willing to participate for, or contribute funds for the matching grant.
Okay, because you said on there to have the town administrator,
Yeah, or whoever is in charge of your funds, because I think every town in the coalition is different. Some, the Board of Health has access or appointed access to, and some have the select board or the town administrator.
So did you hear from anybody from Brookfield?
Yes, I did. I actually spoke with Bob.
Oh, good,
Mears
okay.
this week. Yep.
Because I just forwarded the email because
Yeah.
we didn't have time to meet
No
as
worries.
a board to discuss anything.
Yep.
So I figured
We're
he would
not,
just.
we don't have, they didn't give us the control of the opioid fund, so it has to go through select
So I
board.
did reached out to,
Okay.
yep,
So
I reached
Okay,
out
all
and yes, I did get a hold and I got a
Excellent.
signature from
a
him.
lot of
Yep.
towns give it to the Board of Health, and ours didn't.
Okay.
Hopefully that will change.
Yeah, because I saw other towns had, you know, some meetings to have the residents be able to speak at.
The listening, opioid listening.
Yeah, the
yes.
listening
Mhm.
meeting, yes.
So we actually have opioid session listening. It's a very preliminary session provided for the region. It's March 10th from 4 to 6. Email was sent out about it last week. Holding is doing theirs as well, but we mostly want to do a preliminary one because, we did this through the subgroup that we created last month to do these listening sessions, just to have an idea and really hear from people. It's really the townspeople that makes a big difference and runs these initiatives. So we wanted to do these type of listening sessions, and then came to find out that we were awarded through the grant. The grant itself, and just to provide a quick information, is it's to be able to hire a consultant to then do and gather data across the region and do more like a community assessment just on opioid related. So that way we know where are the gaps, where are the needs as a region, and start with getting more initiatives and use the funds that the towns have allocated specific for those, for opioid substance related issues. So hopefully, I did get the letter from Brookfield, so
Okay.
that's that. I did request an extension just due to the weather, the closures, and all that stuff. So they did give it to me. So the end of the week. So that's still ongoing.
I think I'm good.
You're good. I have one more question
Mhm.
on like policies and procedures, though.
Yeah.
We're a few years in, this thing's been built from scratch. We were like right at the beginning, back in like 2022, 2023 area.
Yeah.
Now that we're kind of building things up, and I know it's really hard, there's 7 different towns, there's a little bit of differences between the different towns, how they operate, but
Mhm.
how can we get more towards standard operating procedures for the coalition so that people know, like, this is what to expect and reports and what, like just a step-by-step of like how the agents interact with boards, how the administrative assistant does, how the nurse, public health nurse and the epidemiologist, and just all the little details so that like information can be, passed along, because boards change, like different people get on boards and people leave, and how do we, so we have that continuity of learned information that we've been building over the years, I feel like that, we need to get to a point where we have them documented in some kind of way that makes it clear, and then you're on the board and we can say, here's all the policies and procedures, you can read these on your time and learn about them, and then like how it operates, because I still learn things every day.
Yep. Yeah.
Being on this board, but it'd be helpful just, for the long term.
Yeah. No,
And maybe get
hear that.
continuity between towns and
Yes.
helping you guys be
Yep.
more efficient if we all could get our acts
Yeah.
together and do things a little bit more
And
similar.
that's the goal of the public health excellence grant PHE, to build that capacity for across the towns and across the region. So part of the work plan that we have for this year is to create a more consistent reporting, or in this case, food establishments reports. So obviously a big intake that we look into was to have a electronic inspection report. So that way things are consistent and things are sent out for that matter. And creating those standards. So last month we discussed about having a regional, or not a regional, but a food application that is used across the region. So that way food establishments that come in, they know exactly what to expect from all the towns, not just one town tells me to do or submit some documents, but the other town doesn't let me do that.
Yeah.
So it's very inconsistent, and I
Like
get
the
that.
mobile food trucks?
Mobile
Yeah.
food trucks, food establishments, temporary food permits, like, it's, I hear it all the time, so, creating that consistency, and it's, at the end of the day, I bring it to, the issue to the board reviews the applications, provides feedback, and that's just a matter of us obviously have that input and, information from the coalition across the members, so.
What do you mean reviews the applications?
So some,
Like the ones that we put out, or what do you mean?
yeah, so if I submit, so last month, I submitted a food establishment application for all the coalition, or for all the advisory to review. We discussed that in last month's meeting. They provided feedback, and then for our next meeting, we'll have more of a discussion and hopefully an approval for towns to use that form moving forward.
I don't remember seeing that in dissent, but
Yeah. It was.
it'd be
it was
nice
done.
if Miriam could send things with like headers so that we could find them, because
Okay.
sometimes she just sends a pretty general header.
As a
It gets
general,
buried
okay.
pretty quickly in the email. If there's something attached to it that we
Yeah.
need to put our eyes on, we may not see it.
Okay.
So if she could just,
Sometimes there's a lot of attachments.
yes, so she
Yes.
could just kind of,
Like I
Okay.
can like scroll.
I'd rather
in.
get 6 emails with
Mhm.
clearly marked what they are than to get one with just a bunch of stuff.
Okay,
pushed
all
in
right.
it.
Exactly. So these type of feedbacks are great, so that way we take it back and we improve it.
Yeah, I know nothing about this,
Yeah.
so,
No, it's okay.
okay.
Moving on, a question about special permit planning versus Board of Health permitting. This is just a question from me. When agents are reviewing like a new plan or, you know, for a new establishment, are they checking to see if the zoning is allowed, or do they just rely on the applicant to do their diligence in making sure that they have zoning permits?
Yes, that's a really good question. And from what I've seen, I don't think it's asked to the planning board.
Well,
If the applicant,
Well,
also
I
one
mean,
thing,
it's sort of like you get, like every town is different. They
Yeah.
have their own zoning, so I
Yeah.
get it's gonna be a lot, but
Yeah.
we have like use regulation tables, and most towns do, but like, there's no check from the agent to say like, there's this issue, or is it just literally like it's on, the onus is on the applicant to make sure that they can do this, and then we give a food permit that's just saying you're allowed to do this activity, but it's not, we're giving you a business license or something
right,
like.
right. We focus on the food, or, I don't know, like, I'm trying to think, like food and
I mean,
applications.
I'm just saying
or-
this because in our town years ago, there used to be the building sequence form, right? And it used to go around to all the different departments, so the wiring and the plumbing
Yeah.
and the building inspector and
Yeah.
the planning board and the Concom and the Board of Health, like everybody, like they'd be like sort of like a sign
Yeah.
off for a person who was trying to open a business, could take that around and say, you know, I got all of my things that I needed to do this. And now it's, there's no form, our
oversight,
building
yeah.
inspector won't use them, and I just, seeing some examples lately of people who have invested in trying to get things together, but there's
Yeah.
not a lot of continuity and communication of like, you need to go here, and you better check with zoning, or you better, oh, you have wetlands on it, you know, like you gotta go here, you know, there's nobody that kind of helps that person navigate that, and I can just see it being really overwhelming, especially if you're a small business, you know, or just, you're just trying, and I don't know what we could do, at least on the applications or whatever, to kind of have that like phrase or something, so if you are working on a form, maybe there could be a statement at least to say,
Yeah.
make sure you
Yeah,
verify.
that's very, very,
Because otherwise they invest and they, you know, and then they find themselves in this.
And
in
who's
this
also
predicament.
checking that people have paid their taxes? Because some people are checking somebody's and not others, so, like, that's a thing. We're not supposed to be giving food or any
Yeah,
permits.
there's like it's not consistently
No,
coming out
there's
from,
nothing.
but it doesn't come from like, our
It's Board
tax
of Health,
collector
yeah.
sends it out, and then it's infrequent.
The town.
It's
Yeah,
just like-
yeah, but, so, I don't know.
And then it's not, once it's sent out, it's not current after a day. I mean, somebody can come, you know, it's
Yeah.
like, how are you supposed to check that? It's difficult, but I know we can't solve all of that just on our board, but if the forms and things like that could kind of spell out a little
I think
more.
what would be helpful is having in the plan review, so if a new establishment comes in a plan review,
Yeah.
have you checked?
So that's another
zoning.
question. Is that plan review required or optional? Because I haven't seen it done, and then I've seen permits issued, then there's no review plan. So you end up in this conversation where it's like, I wish you had done a review plan, because if you had, you would have like seen this section, because it does talk about that in the review plan,
Yeah.
I admit, but it's not like a checkbox, but it's discussed.
Right. And
But
so
I
like,
haven't seen continuity in those review plans being done.
so any establishment that comes into Brookfield and wants to open, or it's a establishment in Brookfield and wants to open a new establishment, I'm talking about food, for instance, would go through a plan review process. And that should be for everybody. When it comes to residential, like residential permit, like cottage operation, they're very limited in food, what they're making, so a plan review is not necessary for that specific individual or that specific operation, because it's very
So
simple.
maybe a short,
And it's just, it could be, yeah, and it could be just a food application that is residential, but also submitting, like maybe have a separate information for residential, what's required for a residential kitchen, which I created, and I shared, will be shared, I think I shared, I can't remember. I think it will be shared for, across the coalition, because we did observe a couple residential with some issues, so wanted to provide an overall education for everyone.
So if someone is creating a plan to open a food establishment and they want some input on how to do things correctly before they submit everything and then have to go back and spend more money and do whatever, do you guys provide that guidance and service for businesses?
Yeah, we provide as much as possible, for sure.
Okay. All right.
all right,
Move
thanks
on.
for. All right, and the next one is discussion of Oak Home Farm Estate / Pups Pizza, 80 Lake Road, food permitting / Title V requirements. I didn't quite
Yeah.
know how to word that, because I didn't have a letter at the time. I'm thinking this is mostly going to be Title V, and are you gonna recuse yourself?
I'm recusing myself.
You're gonna stay at the table though?
Yeah.
Okay.
Is that all right?
Ethics recommends that you
Oh.
step away.
Where do you want to sit?
I don't know, somewhere we can get to a microphone.
I can move, or
You wanna, you don't mind?
Nope.
The old guy, you're gonna see.
Sure,
here.
chair.
No, you
So
can
we
sit
got it. No, you can sit there, I'll pull a
Yeah,
chair
one
up.
of these is free.
I'm not getting the old, no.
Huh?
You get the rolly one.
Okay.
All right. Fire away. What are we doing here?
I'm Mark Farrell, Green Hill Engineering. I've been the designer for Oak Home Farm and the owner here.
Yep.
So I'm not quite sure what you want me to address. I would be glad to answer any questions or concerns or issues you have
yeah, of
about
course.
about the system.
I know this was requested to be put on the agenda as an issue that was brought up recently. I sent out the letter this afternoon. So with that being said, realized that some of the, when we did the walkthrough back, I want to say back in January, with Mass DEP, they did request to have some of the plans be sent out to them because they also wanted to see all of it. And I realized that one of them didn't have an actual certificate of compliance. So I did reach out to our Title V contractor, and she got on top of it, and a certificate of compliance was issued. When I asked to confirm that the system design appeared to be based on approximately 100 seats or just the number of seats, she confirmed yes, it was just the seats, but nothing related with the commercial or the function hall kitchen and the pub's kitchen for that specific banquet hall
Michelle,
area.
just real quick.
Yes.
Is Shelley on the line? I can't tell. She was gonna call remote. Shelley.
There's Title V, Brad and Chris.
Oh.
Is this Title V?
Yeah.
That would be her. That's probably her. So is there a way to see you can unmute just Shelley?
I can't hear her. Is she on?
I
Not yet.
can't, I'm just checking, just to make sure, I just want to make sure she's able to.
We'll check.
Sorry, I didn't want to.
No,
tune into it
that's
and
fine,
have
yeah.
her not-
If we have her, that would be great.
She's not muted, so she should be able to speak if she has her
Can
microphone
she hear
set
us?
up.
It looks like it.
I don't know if sound is coming.
We can definitely get the remote participants too and make sure there's not a technical issue. Brad and Chris, can you hear us?
Oh, there she is.
Okay, great. Shelley, we see you now. Can you hear us? We can't hear
We
you.
can't hear.
We can't hear you. You might have to unmute your microphone.
It's unmuted, she's saying.
She said my mic is on.
Your microphone is on?
Yeah, I had this problem once.
You can hear me, right?
Yeah.
There is typos on this letter and the other one. Yeah, I noticed that there's duplicate Fs.
Yeah, Shelley, it seems like it is an issue on your end. You might need to leave and rejoin the meeting, possibly. See if that helps. And if that doesn't, we can contact Jake for remote assistance. But it seems like it's an issue on her end, the other remote
Sounds like
participants.
it.
Yeah, because other participants
We'll
can
give her
hear.
a couple of minutes.
Okay.
Right.
Do you want me to continue? Or just wait?
Can we pause?
Yeah,
See if
of
she
course.
can come back. I just don't want her to miss what we're talking
Mhm.
about.
Can I say something while we're waiting for her, or should we wait?
Yeah, Christina, you don't have to sit in the kitchen. You can come out in the room. I just think that, you could come sit, like, but you don't have to be in the kitchen. I just meant like the.
supposed to be at the table.
Sorry.
Technology.
Yeah, give her another. I could try it on the cell phone.
We call her?
Do you have a number? Do you have?
Okay.
I have my
We
phone.
do not.
Do I get you back there?
No, you're fine.
Nope. Hi, Shelley? Okay, it looks like you can hear us. Can you hear us? Okay, we still can't hear you.
Let's see if I can call her.
All right.
Hi, Shelley. Just call you on the phone here?
Yeah.
Okay, all right, you can hear us on that though, right?
Yes.
All right, and so when you speak, I'll just have my phone held up to the microphone.
Okay.
Okay. Okay, we can continue, sorry.
So I don't know if you want to add anything else from what I said. Can't remember.
Speak to her and tell, so she knows you're talking to her.
Do you want to add anything else from what I said, Shelley?
So, I'm sorry, I'm trying to get myself together here. Just give me 1 second, please.
I already
There we go.
to be honest.
So, yes, unfortunately, I didn't have a lot of information. Michelle, informed me about the inspection and the kitchen. And, there seems to be a continuous disconnect between, proposed uses and what the Board of Health is receiving for documentation. So it's difficult when I see a plan that has a rectangle that's labeled as a function hall, and then I assume and I apply the flow rates to a function hall and approve a plan, and then later come to understand that there's a kitchen that's associated with that. So that's one thing that I've kind of been advocating for is
Excuse me, I don't mean to interrupt. We can't hear anything that she's saying. I don't know if people know chat or not.
All right, I'm trying.
Is the microphone on?
My microphone's on.
What else
I can hear you guys talking right now. I can hear you, Steve. I can hear you, Maureen. We can't hear her though.
Yeah, so Maureen has her phone on speakerphone up to the microphone, but it seems like it's not picking it up clearly.
Chief did say that it's probably on her side, and she might need to give Teams or like the browser permission to access the microphone. It's not on our side.
Shelley, you want to try to see if you can troubleshoot that?
Yeah, I heard her say something about a browser.
Can you try testing that way? Like if you, Shelley, can you say something right now?
Yep.
Can you guys hear that? Chris, can you hear that? I'm sorry, Chris, can you hear that?
Chris, can you hear that?
Did she say something else again?
Oh, I think we got there. She got to work.
Okay, good. I'm gonna hang up. That's why it's acting. That's why it's. Gotta love technology.
You can hear me?
Yep, we can hear you.
Okay, I'm sorry. So, Mark, can you readdress, I'm sorry, what you said after all that confusion? I apologize.
I think we were just trying to hear what you had to say, Shelley. You talked about when you see a box for a function hall and then you find out there's a kitchen, and I think that's where we lost.
Yep, so it's difficult from a review standpoint to see a plan, especially for a proposed use, whether it be commercial, residential, and not have the benefit of seeing a proposed floor plan. Because from my perspective, I saw a rectangle on a plan that said a function hall. I had no idea that there was going to be a proposed kitchen use that was part of that. But that being said, there are provisions in Title V that allow the use of a kitchen and not dictate that a grease trap be part of that design. And Mark can speak to that. The system is oversized. There is not an anticipated release of grease or anything like that to the system. So with prudence, I guess, dedicated to the design of the system and the environmental impacts and the functionality of the system, he as a professional decided that the use of a grease trap was not necessary. It's now come to my understanding that there is an internal grease trap, which is not part of the Title V code. That is a plumbing code issue. So if the internal grease trap has been approved, then I don't see that there is potentially an issue here. And I guess I would defer to Mark to offer any clarification on that.
The system is over-designed. It basically, the leach field's probably 25% bigger than it needs to be for code, and I just do that as a safety factor because it's good practice. You know, once you're out there, to make the leach field a little bit bigger, it's easy, it doesn't really add any expense. My interpretation is that the primary use is a function hall and grease traps are required for restaurants. So if you read the code, it basically says there's a grease trap shall be provided for kitchen flows at restaurants, nursing homes, schools, hospitals, and other facilities which grease can be expected to be discharged. So they're not a restaurant, they're not a nursing home, school, or a hospital, and they're not a facility where grease can be expected to be discharged. They serve all of their food on paper plates. They don't have any sit-down place there. It's either on paper plates or in a box. Basically, what Puff's Pizza is a food truck. So if it was outside, it wouldn't add any flow to the system. It's just that they've moved the food truck inside for, you know, in the wintertime to keep it heated and not have issues with water and freezing and trying to heat a food truck. So my opinion is they don't need a grease trap. They don't generate any grease. They don't have a stove in there, I believe.
No stove.
No stove,
Just
so
an
they're
oven.
not cooking anything with oil. They have no fryolator, you know, things that would generate grease. They just put together food and, you know.
And they have like a trap under the sink, is that?
But they also have inside, and they have an internal, what we call an internal grease trap. So basically, the kitchen waste is routed through that internal grease trap, and then before it gets commingled with the bathroom wastewater.
Okay.
The other area it's over-designed is that they have, it's permitted for 100 seats as a function hall. In reality, they don't have any events that even come close to that. So they might have 80 people there, but most of the time, things are like 40 or 50 people coming in there for a baby shower or a birthday party or whatever. So the function hall really doesn't add any grease, and Puff's Pizza does not either.
Okay, and again, that was the I guess the observation based on the plans, because the
Right.
plans itself was just assigned as seats, a number of seats,
Right.
right? So it was not clear whether it indeed meets the requirement for the fogs, we call it.
The what? Fog?
Yes.
Yeah.
But if that's the case, I mean, if the size that the system is currently designed meets the code and meets the guidelines, meets the over general wastewater for the dishwasher, the 3-way sink, you know, it's with that, then I guess that's what I wanted to make sure it does.
Yeah, I think that,
because-
I think that they have, like I said, it's over-designed. I think they have extra capacity there, and they have more, it's designed for more seats than they actually are using. And it's, the leach field's 25% bigger than it has to be, and they put in, just as an added safety factor, they put in an internal grease trap.
That was, which was required, I believe, before, right?
Yep.
Okay. Shelley, do you have
And
any?
I think they're working on a public water supply. I mean, that just became,
Yes.
they were going down that avenue. They had, you know, somebody online to do it, and basically then COVID hit, and everything went to be a mess. And then since then, that engineer's retired. So it, you know, the well was constructed, because I had communication with him. I mean, I was sharing with him where the leach fields were to make sure that they met all the requirements of a public water supply. And he's since retired, and so, and they didn't fully get it permitted, but they, you know, for all
Yeah,
practical
yeah.
purposes, they were trying to do the right thing and get it permitted.
Yeah,
From
and
the
I know they're
get-go.
and I know they're working with DEP on that, so that's not the concern here. My concern was if I were to look at a plan, if anybody else comes and looks
Right.
at the plan, and it just shows 100 seats with no background saying
Yeah.
this function hall, you know, see what I mean? Why
Yeah.
could that be?
And I think
raise
it's
a
good
concern?
practice to have some sort of kitchen in a banquet hall, because when,
Yeah.
if somebody comes in and they cater it, it's a good place the caterers can, you know, kind of stage what they're doing. They have better, you know, if they need to wash their hands or not going to the bathroom to do it, they have a
Yeah,
separate
they shouldn't.
facility.
They should've.
So it's just, I think it's good practice to have a, you know, a kitchen in a function hall, because it's likely that food's gonna be served there, and I think that's more compliant than, you know, using the public bathrooms to wash their hands.
For sure, they shouldn't be washing their hands in the bathroom. In the first
So they
place.
have hand wash sinks in
correct.
Pups Pizza.
Yes.
And
yeah.
then they also, you know, in that facility, if the caterers come in there, and they can wash their hands in the big sinks, and,
Yes, yep. So my intention was to make sure that the plan itself reflects what the
Yeah.
purpose of the actual, service or the actual property is for. So that was my intention, nothing
Sure.
else. I wasn't saying, you know, you're a violation, nothing like that, but I want to make sure that is clear. So if somebody else were to come and do an inspection
Right.
or stuff like that, they
Yeah.
know, and they are aware that the plans really reflect what Oakland
What the
is doing.
use is, yeah.
Correct,
Yeah.
correct. That's the only thing. So if we can have some sort of, like, a written, so that way
Sure.
we can be
Yeah, be glad
in
to
the
do it.
file, and we will move forward with that. Make
See,
sense?
You said it's not a restaurant, so there's no
It
special
is, it
permit
is.
involved
I
with
mean-
that, in calling it is it a refreshment stand?
excuse me?
It's,
Like, I mean, it's not we can't say it's a mobile.
it's not a mobile truck.
I'm just looking at zoning, there's two options, there's one's restaurant, eating established, serving on premises only, and the other says refreshment stand, drive-in, or other place for serving of food or beverages.
What are you looking at, Maureen?
Our zoning,
Oh,
I just want to ask the question since you're in front of us. For persons inside and outside the building, did that more closely resemble what that is? I mean, I remember it was a truck and it was kind of there permanently in a way. It wasn't, I mean, it was parked there permanently.
it was
didn't see
parked
it.
there all the time, and then I think
had
on
like a
busy
little
weekends,
shed.
I think they have a few other
And
trucks.
everybody froze in the wintertime and they made the kitchen and it's beautiful.
Yeah.
I was just curious.
I don't know what it falls under, honestly.
Yeah.
Food trucks,
I'm just seeing this
kind
come
of,
up
they
a few
go
times
into
lately.
residential neighborhoods, and they're all over the place.
Yeah.
Because they're on wheels, that's a mobile truck, but I wouldn't consider Pups mobile, because when I went there, like, it wasn't
It's
a
not
truck.
mobile where it
It's
is
not
now,
mobile.
but
No,
they
it's not
kind of,
mobile.
that's
Yeah,
probably the
yeah.
closest thing that it resembles, because it's not a fast food establishment. It's not like McDonald's where you can go get a hamburger anytime you want.
They're only open
they're
at certain hours, right?
Yeah,
Just
and
on
they,
Thursdays.
Thursday,
basically,
Thursday, yeah.
they
Thursday
took the
through Sunday.
contents of the food truck and just moved it into,
The
they used to
function
be a
hall.
horse barn, I think, garage.
Yeah.
And they had bays in there, so they basically just took a bay that wasn't part of the function hall and put Pups Pizzas in there. So I think that,
It's a serving window, if that's even enough, is that, yeah, is that?
I mean, in the food word, I mean, besides the zoning, in the food establishment.
I'm just trying to
In a food
understand
code,
it
yeah.
all, because it's coming up a couple times now around town, and I'm just trying to get my head around, you know, and like we talked before, the sequencing form and stuff, it's just, what are these getting classified as? And
Right. I mean, under the food code eyes, it would be a food establishment.
Yeah,
Not
it's a
necessarily,
food
not, yeah,
establishment,
not
but-
necessarily like mobile.
right, and I think that they're in compliance with that. I mean, they have a hand wash
and I have
station
no
in
issues
there,
with
they
that.
can,
Right.
They
That,
could-
and that was
yeah,
not, that, to be
right.
honest, that's not that's the issue. I think, want to make sure that the plan, the septic, going back to the septic plan, does reflect the actual usage
Right.
of the property. And that's all I wanted to aim.
and I believe
for
in
that
Title
particular-
V, it does, there's adequate capacity. In fact, it's over-designed for the amount of usage.
So you guys asked to be on the agenda, what's the ask from us tonight? Because the letter was just issued, it's dated today, and are you asking for something different on this letter, or?
No, I
discussing
glanced
it,
at the
or-
letter beforehand. I mean, I got a copy of it a little bit later, but I can address whatever the issues that she had brought up in the letter and tonight, and then respond back in writing. I think that's basically what
Okay.
the letter requested.
Yep, I just want to make sure there wasn't something that we had to decide or vote on or something. Okay.
Excuse me, Maureen?
Yep.
Yeah, so, Title V has different, categories or, uses that dictate the flows. And there's no, Title V, unfortunately, for all of us, is not a solid and tight regulation. There are gray areas, there are areas that are subject to interpretation. There is not something that's specifically food establishment. There is restaurant, which is 35 gallons per seat per day. There's a restaurant with kitchen flow. And Title V does not offer a definition of kitchen. There is function hall, which is what the design was predicated upon. So I mean, I would think that because of the internal grease trap, sorry, I'm just scrolling through Title V as I do this. With the internal grease trap, that's an appropriate safeguard for what the current use is. I would say if that kitchen ever gets to be something that graduates to something more substantial as a true kitchen that is serving the function hall, then we need to readdress it at that point. I will back up also and say, again, that this solidifies, we really need to see these floor plans as part of the Board of Health submission so that we can make an educated review on what the proposed use is. And so that all of these issues can be addressed through the design process and not later on in this process that's going to cause people to redo things and, shake things up in a way that could have been addressed earlier. I guess that's my 2 cents on that.
Yep.
Agreed. I totally agree with you, Shelley.
Agreed. My only last question I had, I took a look at the website for Pups Pizza, their pizza. But you did say on here, it says that you sell ice cream and more, and I'm just curious what the ice cream, is this real or is
It
this?
would be a packaged, like a freeze pop, if anything, not like soft serve or scooping ice cream.
And the more is chips?
I don't know what the more is really.
'Cause I think that will help just to understand the full picture, if it's just prescribed.
Yeah. You don't do much more than pizza. You don't
I mean, I
do
saw
ice
your
cream.
menu.
And popcorn.
We don't do, the brewery does the packaged popcorn, we don't
Yeah.
do that.
Okay.
Kettle pie.
Yeah. Yeah, there's really not much
Yeah,
more.
I've only seen pizza, but then I saw the questions come up recently and for somebody else that wanted to sell ice cream and it became an issue and what I'm worried about is there being like disparities of different businesses in town and so if there's ice cream, like whatever, it just needs to be part of the permit application so that people are aware of what's being sold. If there's not action for us, then I don't know. I mean, are you good or are you good, Michelle?
I am good, yeah, I mean,
I think so.
Okay. And you, Shelley?
Yes, I'm satisfied with the new information that I received today relative to the internal grease trap.
I'm just curious, so is this letter stand? Are you still requiring all of those things in the letter?
Yes.
and he said he'll provide, what I requested. Okay. So, I'm fine with that.
Do a letter?
Yeah.
Yeah.
Yeah. Should resolve it, right?
Yeah, I mean, I thought it was gonna be more a request or anything, but
Yeah.
it doesn't
I
seem like
didn't
it,
know.
so.
It just, okay. Right.
Okay, thank you very much.
Thank you.
Have a good evening.
Thank you.
You're on. It says discuss backup health agent role and designation. This was requested by
back over there.
both Kim and Christine.
Thank you for being here. I didn't know you were coming. We had talked, what I thought originally was Mackenzie was gonna be like a consulting agent for us, and then we would use Lester kind of as backup, whatever. And then we've had people in the community that have wanted to work with Mackenzie, and then you have said it's not like a free-for-all, you can't pick like who you want.
Well, it shouldn't be for a resident to just dial up which agent they prefer to work with. That we should be assigning agents by a standard, and we have assigned.
I don't think that was the case. It was Mackenzie had been working with this particular business and they're getting their plan started and they wanted that continued continuity, and I don't know if they necessarily got the same response.
Yeah, I don't know if I agree with that though, because like all.
Okay, let me finish talking, please. So I don't think they really got that from Lester. So, I don't know, I don't think we are all on the same page of what we originally had discussed back in, when did we start talking? Do you remember, Kim?
About what?
Like when we voted on having Mackenzie as a,
I looked back in the meeting minutes about all the agents, and it was, August was when Michelle went on maternity leave, so we delegated additional agents to perform inspections, and then, we delegated Mackenzie as the additional.
Mackenzie left Lester.
Yeah, Mackenzie left Lester,
She
so,
worked full-time in another town.
that's right, so we hired her through the town.
And it was a backup, and I had introduced it to the board, so I'll explain. Because Lester's closed on Fridays, things come up on the weekends, with Michelle having been on maternity leave and things, like, I was concerned that we wouldn't have someone available to come out if we had like a housing call, mostly things like that. I wasn't even thinking about food permitting because that's all generally done through Lester, which makes sense because a lot of our food permitting are food trucks. We don't have a lot of brick and mortar in town, and they permit them for all the the day, whereas Mackenzie has a day job during the day, and so that was kind of the premise around it. But when you talk about somebody who's working with somebody and then they want the continuity, well, a review plan didn't come in until after Mackenzie left. So that's when the official, like, submission of a review plan came in. So I don't really understand the statements around they've been working with that person.
Okay. The way, like, things have been going with all of the recent inspections, and we want everybody in compliance, but from what I've heard from several businesses in town, it doesn't sound like Lester like fully knows our town, our businesses, that we don't have public water supply, we don't have town sewer, and those questions have been asked, and like giving these letters to multiple businesses of non-compliance, and instead of just like having conversations and working with them, like giving them time to get stuff done. I know you're gonna say, well, I've given them 90 days, 120 days, whatever. I don't feel it's working as well as it has in the past. And again, it goes to the continuity with, everything's constantly changing. And Mackenzie was, from what everybody has said, great to work with. She's willing to take on more and do more. And I just kind of wanted to bring up, like, other towns have their own agents. And use, yeah, well, what's to say we can't? We do have the revolving account, correct? And we do have some money to put towards, like, if somebody did want to use Mackenzie, they could.
Help me understand
Help me understand why we can't.
Can I finish?
Go for it.
I mean,
Oh,
help me
done that.
understand the rationale for, like, I want to use this person because I like them more? Like, is that what you're saying?
All right, how about, there's been all these businesses in town that have been in business, been permitted every year, everything's fine, and all of a sudden we're shutting down a church. We're sending out all these letters of compliance. We've had our Title V people sign off on things, and now it's being brought up. And I'm not talking about Oakholm Farm specifically. I'm talking about, say, Wildberry Acres, who just put in a $40,000 septic, and now Lester's coming in and telling them, like, their businesses are getting upset. Everything is like, we're just trying to do it right, and all of a sudden we're being told.
Wildberry Acres has to be on next month's agenda, so I want to make sure we don't get down that road just yet, because they asked to be moved to March.
Well, we did, I guess I can't jump ahead to mention Megan, but I don't know. I feel like I'm thinking of Brookfield, and what's best for Brookfield is having, like, one person that someone can go to. Like, we now have a clerk that is versed in both with the town and with Lester. Just trying to focus on moving forward what is going to be the least complicated route to go and the most easy to work with are businesses and residents in town. And I don't feel like the way things are going is working.
What was your interpretation of how much work you'd be doing for Brookfield?
I mean, my interpretation, that was as needed, whenever you guys needed me to.
But for anything, correct?
Yeah, but it was inspectional, it wasn't permitting.
I mean, I think we talked about maybe looking at some permit applications, but I don't think we definitively said I would be reviewing.
Everything I remember was mostly if you needed to get out to inspection. The big concern I had was, like, there was two things. If we had a housing issue, something
Yeah,
that,
we
you know,
already
somebody
said that.
called it. Thank you. Or if we had needed an agent for like the saddest, we have events, right? And we may have to inspect a bunch of vendors like on a Saturday morning. The concern was whether we had somebody continuity-wise from Leicester, and then we'd be able to say, hey, you know, we're gonna need an agent out there to inspect everybody before, and have her do that on like on a weekend. I think, I wanna just ask you, is that still like a gap for Leicester?
No.
Like, okay.
No, I mean, we have myself, we have a regional agent and a part-time agent.
I know, you have more people
So,
than we had before,
yeah,
but
there won't be
this-
a gap to cover weekends.
So, I guess could the board discuss possibly having our own agent back again, where we could hire someone, even if it's one day a week, and then we switch to using Lester as backup?
Well, that was great when Mackenzie offered to be able to be a backup agent so that we had somebody for the town that way. For 2 years, I think I searched for, you know, calling around everybody I could find that was an agent, and they're all getting hired into these coalitions. The state's moved to this regionalization model, and most of the agents that you find are, you know, either working for a town large like Shrewsbury that has literally hundreds of things and has a staff, or they're in a coalition where they're getting their pay and benefits that way. You know, contractors that are available for a small amount of work, you know, in our town, it's hard to find them.
Is it a small amount of work though? Because looking at last year's in the coalition, like we use the coalition the most.
We did, but we're also a whole bunch of tiny little towns in this coalition, right? We're not Shrewsbury, we're not Worcester, we're not,
No, but she's
Leicester.
talking about Brookfield.
so like in
I
our
think itself,
coalition,
right?
Leicester has a full-time agent.
They have their own
Leicester
agent.
has a
Okay.
full-time agent, and so does Holden,
Right.
and those are big towns,
Yeah.
much bigger than us, but
North Brookfield,
what, you know,
they have a lot of
we're not gonna be able
businesses.
to hire
They don't have-
someone
they
and
don't have
pay
an
them benefits.
You guys are
I mean,
the
it's
agents.
like, it has to be contract, right? It has to be somebody who's not looking to be an employee that gets benefits through our town.
Right.
So it's it's contract. But if you're hiring someone, that's like a question to take to town meeting. Because
Well,
now
no,
you've
okay,
gotta-
so then,
now you've gotta
what
pay
about
them
contracting
benefits.
somebody then?
We have her, so, like, but she's gonna be limited in it, but if you guys wanna look around and see if there's somebody else available, we can contract with more than one agent. I'm just
I
kinda
guess,
confused why we're kinda, like, we should be leaning in on the PHE grant as much as we can.
yeah, but they've asked us for more money.
For the admin. For the admin.
I don't know, it just doesn't, it
It's
doesn't
not
feel right, and I
enough for
just wanna
agents.
discuss.
I don't, yeah, but it's for the admin so that they can disperse funds through the coalition, because they were losing a grant
That was just.
that
the
was to pay
contract.
for all of the administrative.
But I think it was a way to get
Personnel.
away from the conflict of interest of having Megan work for us and also work for the coalition, correct?
We're talking conflicts of interest now, because this
Go
whole.
for
like,
it, Maureen, go for
You
it.
know what, your 50 food permits in Brookfield last year, your business was half of those. And if.
What do you,
s-
what?
Half of the food permits were for your business, events for your company or.
Last year?
Yeah, last year, half of our food permits were either.
What, for the
For
food trucks
Oaklawn?
that came to Oaklawn?
Yes, yeah,
Oh, okay, woo.
but, well, you're a board member, Christina.
Okay, I had nothing to do with any of that.
You're still a board member.
Okay,
You're
I'm not gonna
appointed.
fight in front of
You're
everybody over
elected.
like your ethics stuff. I am here to discuss things, to make it easier for, do you want me to name all the
Did you
businesses
take the
that have?
ethics training?
I had to.
Good.
Okay, but
So-
can you stop interrupting me? So I have had
I'm trying to
multiple.
help you stop yourself right now because you're not even supposed
I'm
to be
trying to
talking
hear-
about food
speak-
permitting. You're not even supposed
Why
to
did you
be.
ask me to join this board, Maureen?
I
Because
didn't.
you thought that I was very well versed in the food permitting process and I would be an asset to this board.
But
So
I
don't throw it
also-
back in my face right now.
You-
Please stop interrupting me. I am here to
You have to
represent
chair this
the
board right now,
businesses.
So if you wanted to take over as chair, you should have done it.
Oh my gosh,
Now I'm gonna
she's
just tell you, Christina, you're not supposed to be discussing your competitors.
I'm not discussing my competitors. I am
don't
here
think it's a
to
competitor.
discuss the businesses that have come to me upset and confused because all along they have been doing things where they think is the right way. I am
know.
here to voice it and represent that.
And I
If you
feel
want to
really
twist
awful
it,
for
stop,
them.
please. You are the queen of not liking people interrupt. Please stop. This is what I am here to discuss for what is going to be best for the town. I'm done in 2 months. I cannot wait. I will not be here to, whatever. You have made your point in all of the minutes to point me out, whatever. I am here to represent these people that are not feeling there is consistency, they're confused, they're trying to do things right, and then they're told they're non-compliant. I'm trying to make it right. So if you want to keep trying to take me out for whatever ethics, go for it.
I'm not trying to take you out, Christina. I'm just,
Can we just have a
This board's really
discussion about this
compromised.
and her stop bringing up ethics? I can step out of this if you two want to talk about it, because you also put it on for the agenda, I believe. So I can step back and you two, if you'd like, if that would make you more comfortable.
I asked for it to be on the agenda because it was asked to be on the agenda last month and it didn't get put on the agenda. And so I had questions about it as well.
yeah, it was asked to be put on the agenda after I had moved the meeting start time closer to public hearing. And as you know, the public hearing, I mean, we were here for like 2.5 hours, so the agenda gets too crazy. This agenda is very large too. The meetings just get very long. That's why I pushed it to this month.
That's fine.
Because I didn't want to have it on
I
last
just,
month.
so for me, the as needed is like a gray area. I don't, like, I guess my question for you is like, what work would you be willing to do? Like, would you be willing to do more for the town?
Yeah, I can do whatever you guys need me to do. Whatever you need. You're able to be here during the days and...
I mean, yeah, I do a lot with Shrewsbury, like off hours, so I get a lot of comp time. So I can, if you need me, I can figure it out.
So my thing is like, Mackenzie's had a great reputation with the town. And if, like, I don't know why we can't make her the primary health agent, and then anything that you can't do or don't have time for, to send it to the coalition, to have those agents be the backup agents.
I just don't understand why that is the way you're saying it, because, and I'll say a couple of things, even though, you know, I can tell you're irritated, Christina. The problem I have with the way you're asking this is the staff at Leicester is completely competent and they do their job well. She's competent and she does her job well.
Well, I'm asking
I really
because
think she's great. Let me have a few
Sure.
words, okay?
She hates to be
She
interrupted.
is good at her job. She's great with the housing. Absolutely, I think, things with housing. But does it make sense to have her be the primary and then Leicester, the coalition, that we have a intermunicipal agreement that's not just signed through us, but also with the select board, where we get, the state has given millions of dollars in grant money, so to have this set up and then just flip it. And then we're talking about a couple of businesses, but I'm gonna tell you, Christine, that this is the problem I have. One of those businesses is a business partner of yours. You're both on board of director for an organization together.
Who,
The
what
other,
is she talking about?
yeah, I know exactly, you know who I'm talking about.
No,
I
say,
think you're
tell me
going
what
down
you're
a rabbit
talking
hole.
about,
It has
please.
nothing to do with what we're talking about
No,
right now.
explain what you're talking
You've
about.
talked about a couple of businesses being upset about the way things are. I know what's
I'm
in
talking about
yours.
Quabog Church, the Congregational Church, White's Landing, Wildberry Acres.
I'm not even aware of anything with the churches, any issues. Like, I have no idea. what
I just
this
found
is.
out today.
Okay. Well, I don't know. But I know you brought up Wildberry Acres, and I feel
Well, yeah,
there's-
we were all given the she emailed the whole board.
Yeah, and
Yeah.
I am very sad to see that, but part of my problem with it is, here you are operating and having food service in a rural residential zone, and then she's trying to do the same thing and
Yeah, and I
getting told
would
by,
like-
and getting told by planning that she can't do it because it's not zoned. Like,
She's
there's
not
no
being,
zoning.
you're the one that brought up planning and zoning with her.
I did because I looked at the zoning.
Yeah, I've also looked at planning and for her, I don't have it in front of
The
me.
reason
Can I
looked at
finish?
it-
I will send it to you if you'd like. What she's doing is no different than what we do.
I know.
Right, so what's the issue?
How
So
does
the
this have
issue
anything
is-
to
Yeah,
do
why
with
are you bringing
discussing
up-
Mackenzie
issue
as
is
It doesn't.
the backup agent?
Because it's a question of principle around why you're trying to flip.
I am not flipping,
lesser
Maureen.
from-
I am not
Well,
flipping.
you suggested her as the
I
primary
have been
and
a
then as
part
the
of
backup.
this board, and I have listened to the coalition's meetings, and they have their own agents. I am just curious and wonder why. Well, if we have somebody that's willing to be our primary agent, what's the problem with that? Because you think
Because-
there's a conflict?
No, I think the problem is they have employees that are agents. They're on the payroll. They have
Which we
benefits.
delegated them as agents, and we can delegate them
No,
to not be.
that's for Leicester, but you're talking about the two towns that have their own agents, or big towns, and they employ them.
We
They're
always
employees.
had an agent before.
Yeah,
the
and we can
coalition.
always go
We've
on
always
the
had a
town
contact
floor and
agent.
ask the town for more money delegated to the Board of Health to pay an agent. If
So
we
why
need
would
more
we
money in the
ask-
budget.
why
So,
would we
wait,
ask
go back to
taxpayers
we
that?
get $1 million grants or whatever for Leicester.
If it's important to them and it's important to the residents to make sure that our, like, things are properly
The majority
handled,
of
then they would
residents are
pay
probably
for an
quite
agent.
Satisfied with Leicester Coalition.
Or they don't know
Did
what
you
the
wanna,
hell's
do you wanna
going
do a
on.
survey?
I'm not gonna, you can.
Well, I'm just saying, well, you're saying that most people are, so.
Well, there's businesses and then there's all of the residents, right? And I don't, you start talking.
Yeah, but the residents are the
couple
ones who
people that
support
you
the
know.
businesses and use these businesses.
And the only reason the zoning came into it is because she, talked about how I asked about zoning just to make sure she didn't invest money into something she couldn't do. And then she says, oh, I checked with zoning, I saw in just their December meeting.
We
there was
shouldn't
a
be talking
question
about
that went to
Wildberry
her.
Acres right now. That is for next month, because
Well-
trust me, I have a lot of things I
Okay.
feel like I can clear that up really quick. But let's get back to the agenda
reason
item
was
here.
for the conflict of interest. So, there are zoning issues, and yet you have some zoning issues for yourself.
No, I don't. We have
do.
all of our special permits, Maureen.
You do?
Yeah. But that's not what we're talking about on the agenda here, okay?
We're talking about the agents, and we're trying to change up the agents based on, you used a couple of examples. You said you're hearing complaints.
Yes,
You are.
correct.
No, I have as
And
well.
you are.
Yeah, I have.
Okay. And I
Go to
only
any
just
of the
heard from
businesses
one.
that have recently been inspected and talk to them.
And ask them how
Go
it's
talk to
going.
the business owners. And then talk to the residents who utilize these businesses and love these businesses.
So
and-
I'm just
and-
trying to be respectful because Michelle's sitting here. What is it about that's happening that's like a problem? Like, just say it.
Did you guys shut down Quabog Church?
We didn't shut down. We said we found issues.
Yep.
They didn't have a sanitizer. as a food establishment, not having a sanitizer is a big issue. They were doing coffee, and we said, okay, continue doing the coffee, but no food service moving forward.
Okay,
So that's not
did you
shutting
have
down.
conversations with them of just like some corrective measures that they can do and just follow up? Or are they gonna get another, like a non-compliance letter and blah, blah, blah?
The
and all
only
that?
2 letters that we send out
Yeah.
have been for Wildberry Farms and Oakham.
Okay.
Those are the 2 compliance letters
Okay,
that you're
so
talking
Quabog
about.
Church feels like you shut them down. That's what they said. So there's like communication issues or something. Is there,
So when we do these inspections, and
Yeah.
yes, we start by saying, these inspections may be different than what you've been used to, but we're here to work with you. And that has been we're going there for
That's not
basic.
how they feel, that you guys are coming at them though.
Unfortunately,
So
things were not,
being on this
unfortunately.
board and representing, and like when everybody says the Board of Health, to me, I'm like, that's me, that's my name. And I don't like it.
We're providing the services that food establishment and food inspection we should be doing as the basics. And the basics are, you should have a sanitizer, you should have a properly wear washing to use.
Yeah, so,
And all these things that are basics that
Correct.
some of them have not had it for a while. So then we are to educate and providing some educational purposes and conversations. So whether they feel that, yes, White's Landing you mentioned, we had a whole conversation with her. She does not have any food establishment, she didn't have any sanitizer. What did we say? You can't do any food services until you have you have a sanitizer moving forward. We talk about the public water supply because indeed they do have a well. So all of these are reviewed, and I'm sorry, because I am training, and I shouldn't be sorry because I'm training inspectors to have the knowledge they need to have the basic knowledge on public health and doing it properly, whether it comes with food, septic, well supply, all that stuff, all covered. So yes, things have been brought up because before it wasn't brought up. And my caveat has been, let's move forward. I'm here to work together. I'm here to obviously provide the education.
But it's not being move forward or work together like smoothly. Like there's no reason Leah should have to come in to speak to the board. There's no reason Pups or Oakham should have come in to speak to the board, like, because they're not sure. Like the communications from Lester, now that, can we move on? Well, no, we're not, but the communications have been, weeks go by, and that doesn't really work well for people who are trying to get their permits, get things done. It never used to be like this.
Communication in one sense.
Like, it took 5 days to hear back from you.
Yes, so you email on a Friday, and I don't work Fridays.
Okay.
And
There was other things.
what I'm trying to say, so if you email me on a Friday, if it's an emergency, I will respond. It can wait until Monday, when I'm back to work.
Okay.
What about like when you guys are doing these inspections and then you bring up like very big concerns to businesses that,
Like what?
I mean, someone that just put a brand new septic in and then you tell them that it's not good enough. And then it takes a long time for them to get this letter, stating the facts.
You're talking about Wildberry Farms. You're bringing it up.
Can I speak on Wildberry Farms?
Yeah.
She is doing something, my understanding is that she has completely changed the usage from when I was there. That's what food trucks or something are cooking in there?
So no,
No,
that's not
okay,
what's
that's
happening.
what
So I really think we
understood. Am I
should table
wrong?
Wildberry
Yeah.
Acres until they're here in March.
I'm just
I
trying to
just want to
understand
make
the
it
feedback.
easy for Brookfield. This
I do
doesn't
want
feel
to say,
easy.
PHE, the Public Health Excellence Grant, provides the minimal standards that boards of health need to meet. Whether you like it or the board doesn't like it, the board is dysfunctional. I mean, there are ways to say, there are certain towns that are violating the IMA by not being compliant, and that can be a sense of saying, I'm sorry, we can leave Brookfield. I don't want to get to the point. I want to provide services to you guys. We have been doing the services from the beginning. It's just now more standard and it's more, I'm sorry, more thorough.
Okay, well, I don't know, maybe we table this. Unless you have anything else for now.
No. There's
So
a lot to
then-
regurgitate or think about.
Yeah. Sorry, Mackenzie.
I'm good. Here's the reason I left.
All right, the next item, you asked to have, request to discuss paper road dumping /
No, you're
compost.
skipping over,
Number
Oh, the clerk, I'm
7.
sorry. Discussion regarding Board of Health clerk role.
so, Megan's been great up until we voted for like her pay and she's working for us and now it's like harder to hear back from her right away. And we also were under the impression she would like be at meetings to do minutes and I asked her about it and she's like, oh yeah, it was mentioned, but I don't know. I don't know, her communication hasn't been like it used to be.
I'll give you my perspective of what might be going on. I was recused for that topic.
Yeah.
But you
You
weren't the month
guys-
before.
Well, she was hired as a temp to cover until we hired for the clerk, right? So she was emergency coming in, helping out, just helping out for a few hours a week. Taking care of filing, doing the turnovers and the warrants. That was all. She was only about 2 to 3 hours a week. When we got the applications in, I recused myself from that topic because one of those applications was an abutter to me. I don't know her a lot, but she is an abutter. So I recused myself. So I did not hire Megan for the clerk position. And I was kind of surprised that you guys hired without actually bringing them in for an interview where you would talk about expectations and talk about what you wanted her to do. Because the clerk role is different from a
That is
temp
not the way you
contract.
presented it to us, though.
Can't even
It's
believe
not
this
my-
right
you know,
now,
you
actually.
like to use me as a scapegoat here. I had to
I'm
recuse
not.
myself. I had to recuse myself. I had to. I'm required
I
to.
asked you why she wasn't here for the meeting, and you were like, I don't know, she's upstairs. Why don't you go ask her?
Yeah, but
You had said that she was gonna do our minutes.
I didn't say
And
that
she would
was
come to
going
our meeting?
I assumed she would, but you guys hired her without having a conversation to make sure she knew, and you guys were all agreed on what she would be
Okay,
doing.
so what you're proposing here is that we should have a meeting with her.
Right, well, so why didn't she
I
get
would.
asked to
I
come to
asked
this
her,
meeting?
I asked you twice to have her come to the meeting.
She is probably still upstairs working, but I'll tell you, she did not want to come to this meeting. She's not comfortable.
But
Why?
why?
I've
I
never
don't know
talked to
why.
her.
I've never
Really?
even met her. I've had nothing but wonderful correspondences with her. So please elaborate of why
I
you
don't
feel
know,
that way.
Christina.
You don't?
I don't know why.
Wow.
It's not me.
Oh. Okay.
I work with her every week.
Oh.
Well, I
So
have to
that-
sign
so
all
that's
the
how you know?
warrants. I have to sign the paperwork. That's what I
Okay.
deal with her. So
Oh.
I deal with her for that. And she's lovely. But
I
I think she's
thought so,
intimidated
yeah.
to be here.
really? Okay.
That's my guess.
Oh.
Well, don't be,
Okay.
listen.
All right. I don't
Have a
even
call
know
with
anymore.
her. Ask her. I don't know. I mean, this is feedback that you're giving, and I don't see that. So yeah, I feel like, I mean, this wouldn't be something I would. I think she's excellent. I think
I'm
she
not
does the
saying
job
she's
excellent.
not.
I don't find her communication.
We hired her right away because Megan is great. I've asked a couple times to have her come. I would like to meet her. I guess I could hope she's still here after. I don't know, but
I mean, as long as I've been on the board, when we've had a clerk, they've came to the meeting, so I don't understand why this is any different.
I don't either.
None of it
I-
feels
I-
right
I-
at all.
I don't know. And I
What do you mean you
how
don't know? Like, they were all required to be here.
I don't know why it's like this now, but I wasn't part of I did not hire her.
But you do know why
Yeah,
she's
but you're the
uncomfortable.
chair.
Just because I'm the chair doesn't mean, like, I know all the details of why.
Yes,
she's
it is. You know so many more
No.
details about things that we never know about.
You guys know all about things, you guys just
Okay, all right,
relate
we're
a
not
whole bunch
gonna
of things I
do
know
this.
nothing about.
Okay.
It's a two-way street.
All right.
Well, that was
We
from
can't talk to each
feedback
other.
from residents.
So-
Getting feedback from different people is a lot different
Well,
than
you had some
talking
feedback
to
here.
our
I
clerk.
suggest that you go have another conversation
Are we
with her.
paying
Okay,
Lester?
that is fine.
Are we paying Lester? You brushed over this and pointed fingers at you, projected at me, but when I brought up are we paying Lester the 15,000, whatever, to make it not a conflict of interest of having Megan be our clerk, like hiring Megan as our clerk and also her working for Lester, or why really do we have to
I
pay
don't
Lester
really-
if they get like $1 million, you said? Why are we doing that? Can you just be clear about it? Because it didn't feel good in the beginning and I just don't feel like I know enough about it.
We'll have to put that on the next month's agenda because that's back to a different conversation that we covered, but it's not on here tonight. But
Okay, well,
It's in the minutes that we
discussing-
have to
Just go
discuss
with
that I don't remember
Okay.
making motions for, but,
okay. Everything's recorded, I think, so
yeah,
you can look at it.
okay. I guess, can we put this on, this agenda item on to the next month and
Sure, yeah.
table that for further discussion, please? Move on.
Okay, request to discuss Hebert Road dumping/compost.
Yeah, can you tell us about that?
I don't know, you guys asked it to be on the agenda.
Yeah, well, it was brought to our attention that you're involved with it, so
No.
we had not
I
heard
received
about it.
correspondence about it, asking about, and I have no idea.
So, the water commissioners reached out, Don Taft, back maybe, was it October of last year, about composting. The conversation was around creating a composting site at that property. I said, I'll ask the DEP for information on that because it's the state that permits those. The section chief sent me the application form for any town that wants to start a composting activity. I sent that to the select board because it's a select board purview item. It's not a Board of Health purview item. I simply contacted the DEP so that somebody would get the form and give it to them so that they could take it and deal with it, push it forward if that's what they want to do or not want to do. It's not our board. It doesn't belong to here. And the reason it doesn't belong to us is because the property is town of Brookfield owned, but it's in East Brookfield. And so if there's any involvement with the Board of Health, it belongs to the East Brookfield Board of Health. So it's not even in our purview.
Oh, thank you so much for clearing that up.
Well, it was really nothing at the time, so I don't know why it's become something. It was somebody asked.
Has it become
about
something?
it.
We just wanted
I
to
know
know about it.
Yeah,
Well, the way you just said it, you tell me you've been doing, no, I just worded along, being helpful.
Okay. Good to know.
what I saw was concerns as to the location. But,
Yeah, they had
so that they
concerns
need
for
to
the
send it
thing
to East
and
Brookfield.
And I checked with the section chief on like what the distance from a wellhead had to be. I'll be honest with you right now, our wellheads are much more risk from the river pollution that we get from Spencer than anything that in the composting site. But it's still, like, it's a DEP permit, it's state permit that a town would get, the select board would enter that with the DEP.
Okay.
The select board, if there's anything to do with the local board of health, they have to go to East Brookfield because the town owns the property in East Brookfield.
So it has nothing to do with our Board of Health.
Nothing.
Okay, great.
Can I just ask why, I mean, I feel like we could have prevented a lot of this by just addressing it when it came up.
It didn't come up, like, it.
Well,
Yeah,
I
but
guess-
did you speak on the behalf of the board as the
No, I spoke
chair?
on myself, I was just reaching out to the DEP to get a form.
Okay.
I am allowed to have my
Of
own,
course.
thought,
Yeah.
yeah, just like you guys. So I
Yeah.
was helpful to a other group that was looking for information.
Okay, that's clears it up. All right. Yeah.
We got a letter for FDA marketing granted orders for electronic cigarettes and nicotine pouches. This came in from Cheryl Spar from Mass Association of Health Boards. It was a draft. I sent it to KP Law because she had said that we should make sure KP Law reviews it, so they reviewed it and provided us a draft. So you have that draft in front of you. So the instructions were to all, and I'm sorry, it came from Cheryl Spar had worked on it, but it came from someone from MHOA, tobacco grant recipients. So they heard about, it was a presentation on the FDA marketing granted orders, and the attachments below address it. The attachments include a letter from the FDA discussing the MGO and the effects it has on many vape and oral nicotine products, the best practices guidance document, and a template letter that your Board of Health can send out to the permitted tobacco retailers in our municipality. So it says, after consulting with your legal counsel, it would be helpful if your board makes a decision as to how to proceed. If you intend to educate your retailers regarding this information, I recommend that you provide each of them with a finalized letter. This draft that we have. And then on our letterhead, so we just have to put it on our letterhead. And then, let's see, in many cases you have an MOU with MHOA, yes we do, for inspections. These retail store inspections have been completed in municipality for fiscal year 26. An inspection for those products by MHOA can be incorporated into the retail inspections during fiscal year 27 if inspections are included in that MOU. Alternatively, your department could do the inspections to ensure that these products have been removed as your time allows. Some municipalities may decide not to address this issue until a later time. And if the inspections have not been done yet by MHOA and your MOU specifies retail store inspections, it's important that you notify them as soon as possible as to how you'd like to proceed. Meaning, do you want the inspector to follow the best practices on the guidance document during the fiscal year 26 inspections and provide your department with information to pass on to the FDA if there is a violation? So it sounds like we need to decide if we just want to send this to our retailers. And basically
So this is a thing happening due to state, and we can decide to be nice and send this or not? Is that basically what this is?
Yeah, I think we should send it,
Yeah.
so. So I'll ask Megan to, we'll put it on our letterhead, take out the draft, if you, I mean, I'm not gonna dare touch the document. Legal's looked at it, and so has MHOA, but you can have them put it on letterhead and mail it out to all of the retailers. that have permits.
So why wouldn't the state just send this to the
They
businesses?
kick the can down to the towns.
It references the regulation of the Brookfield Board of Health restricting the sale of tobacco products. So it's referencing our local regulation, which then references the states.
Okay. Thank you.
And this is FDA, so it's federal.
Mm-hmm.
Okay.
I'm just reading through. Yeah, I think we should definitely send this to our local businesses,
You
putting
making
our
that
letterhead
motion?
on it.
Are you making that motion?
Yeah, I'll make a motion that we put our letterhead on this and send it to our Brookfield businesses that sell tobacco.
Second.
Second.
Any further discussion?
Nope.
All in favor?
Aye.
Aye.
Aye. The next one is the Massachusetts Department of Environmental Protection proposed changes to 310 CMR 22 drinking water regulations and 314 CMR 5.0 groundwater discharge permit program. You got a copy of this notification from the DEP. Review. Just a notification that they are holding a public hearing on March 10th. The information in the document, also available online. And if you want to attend, if you have comments around that, they're making the proposed changes that are contained in the letter. So it's more of an FYI for that, okay?
Thank you.
The next topic, Massachusetts Health Officers Association Tobacco Control Compliance Checks. I just wanted to report, I got an email from Kathleen DeFore, who's the tobacco agent. She said that youth access compliance checks were conducted for Brookfield's 4 tobacco retailers on 2/10/26. I'm pleased to report that no sales of tobacco products were made during these routine checks. So that's good news, and so this report is attached to your records. So just wanted to report, so that's actually good.
Do we have
Any
that?
questions? I think I sent it to you. Oh, it's just an email.
Oh, okay.
I just had it
Oh,
to
it
read
might
to
be
you.
on the back of this one.
All right, amendment to tobacco regulations continued. I gave you a red line and a clean. The red line's double-sided, it's easier. Differentiate.
then page
One's
2.
double-sided and
I put
one's
the
not.
red line
Oh,
double sided
okay.
so that we could
I
differentiate it.
skipped, this page was stuck, okay. I'm so confused.
Well, section K and the other one got crossed out, so then they stopped matching up at K.
Okay, yeah, it's not matching at all, and I'm like,
Yeah, no, she did a good job catching on to the K got eliminated, so then everything got
Okay.
moved up a letter.
right, but. Okay.
Do you have the copy that you want us to sign?
Or we have to make a motion to vote on it?
Okay.
So I'll make the motion that we adopt the amended tobacco regulation.
Second?
Discussion. I made the changes. I'm very happy to see that the youth compliance checks were positive this time going around, so that's actually a good sign. That would make me feel more comfortable. But my concern is, you made some statements that you talked to them, and but you gave us a letter at the last meeting. You made a statement, but in that letter, it said that you were appointed and not elected.
I was originally appointed.
But you were elected in 2023.
Okay.
The law is different for an
Okay.
elected official. You don't
Alright.
have to be a jerk.
You don't have to be the way you are either.
Well, you're not listening to me, and I've been trying to get you
No,
to
I've
just listen.
shut off because the way you talk to people, it's disgusting. So, all right,
Well,
I'll say it again.
I guess it's like,
What was that, Maureen?
the two-way street.
Well, you gotta, is this really necessary?
It's necessary.
Okay,
yeah.
so repeat it again, please.
You made a verbal disclosure
Okay,
at our last meeting,
would you like me
where
to
you said
fix
you...
my disclosure?
Huh?
Do you want me to change a word in my disclosure? Would that make you feel better?
No, you made the statements that already happened in the last
Okay.
meeting. But you said you were an appointee. The facts that the Ethics Commission came back in their letter to you stated that you were an appointed member of the Board of Health, but you're an elected member of the Board of Health. And I wanted you to be aware, but unfortunately,
Thank you.
couldn't really, well, it said that you had no financial interest in the brewery.
Hey, yeah? Do you see my name anywhere on it?
Yes, I do.
Oh, where?
On your mortgage, on the fact that you own the land and
Okay.
building,
Okay.
all right? So you're asking me, the fact that you applied for food permits for the brewery, used your food protection manager information.
Okay.
Okay, and because the law, the section regarding financial conflicts of interest is different for elected officials than it is for appointed officials.
Okay.
If you're an appointed official, you can make a written disclosure, submit it to your appointing authority, and they will meet and make a determination whether or not you can participate. You're elected, you have no appointing authority. So
Yeah, but shouldn't that be the Ethics Commission she spoke with? That's
the
their
information-
problem.
But no, it's not their problem. It's her problem. And
Okay, so if I said it
and I
wrong,
know
so then I
she's
have to correct
mad at
it?
me because I called the DP because I didn't know about the
Oh
animal
my God,
license.
none of this
I
is
know.
necessary.
No,
I
I
should
know
have
you're-
never said yes to joining this board when you asked me.
That's
It's
fine.
my
I
first
didn't-
mistake.
That's fine.
You,
That's fine.
what does
I'm
this,
trying
is
to
this
help
part of
you.
the discussion for the frickin' tobacco reg? Like,
Because you're automatic when you're.
What the
Can
hell?
I finish so that you
no,
know?
I don't
want
really
you to know.
think you need, I don't really care what you have to say. I really don't. I'm done with you.
You-
I want you to stick to the agenda, please.
We're in discussion about the tobacco regulations.
And you want it all on the record, I know, because you're
I
gonna write a
do.
book in the minutes to,
Due diligence, and she contacted Ethics.
but I
And,
apparently said it wrong, so I'll apologize.
yeah,
That's
but why
my concern
is the
for her.
discrepancy
You're not
being
truly
brought up right
concerned for me.
now?
Stop
I am.
bullshitting.
No,
Just,
I am.
okay.
I am, Christina.
Really? Okay.
Because you have an automatic conflict, financial conflict.
Okay.
An
The
automatic
tobacco
when you're elected.
regulation?
Yes. If you actually
They don't
read the
sell
letter,
tobacco.
yes.
She doesn't sell tobacco.
She sells her The
Hurry up,
brewery sells
this is
beer.
Nothing
going on,
in
like,
this
2 minutes.
regulation
Stores.
has to
Not
do
just one,
with,
2 of the stores.
nothing in this
No,
regulation has to
It's
do
not in Bay Path or
with
Bay State or wherever the
her
frick it's
or their
called. Is that what-
businesses.
When? I
December-
just asked and they said we
January 1st.
didn't have our beer there. You are taking this. You do things so crooked and wrong.
No,
Stick
not
to the
crooked and
frickin'
wrong.
tobacco regulation and we can take this up
Right.
on
I'm just
another
pointing out.
agenda item if you wanna
I've
publicly
said my
put me
piece.
out there.
I've said my
Okay,
piece.
okay, let's move on.
Vote.
Thank you. I'm in favor. Are you?
Yeah, I,
And I vote no.
Okay, move on.
you're the one that wanted this regulation.
No,
She just-
I'm not the one that wanted the
It's
regulation.
not worth discussing anymore.
was
We already voted.
It was a regulation template that came through from the state. Making like I wanted it is false, okay? If I didn't want it and I just tucked it away and didn't tell you, then I'd be guilty of malfeasance, okay? I brought it to the board because the board has to review it and look at it, all right? It didn't mean it was my opinion this way or that way. I don't have an opinion about it, really.
Okay, you had to
okay?
present it
I'm
to the
just-
board, it's been presented to
and
the
we
board.
met many
We've amended
months
the
ago.
regulation,
Okay?
we voted on it,
Yeah,
let's
we did
sign
all
it
that.
and be done with it.
All right.
Thank you.
Here you go.
Who is going to send this to the businesses?
Well, let's start with, where's your effective date? And then,
Just give a simple answer. Don't be nasty.
well, someone's gonna get it out to, well, you're being nasty to me.
Yeah, I'm like so frustrated with the way you
I-
speak to
it's
people.
like-
Let's
Sorry.
speak nice.
You need to put it in the paper. It needs to run in the paper for it to be legal.
You need to. Who's you?
Whoever's gonna be the chair. So, and sign it.
The entire regulation has to be public?
It's gotta be
Published?
it's gotta be a hearing, like not hearing notice, but a notice. You don't have to put the whole thing in. I'll show you the prior one, or whoever does it. I will send a copy of what was previously stated.
Okay.
And then you may have to tweak it, but you send it to, I'll give you the email address for the newspaper that we have the account with. I think you have like a Friday deadline for the next week, that's kind of how it works.
So it goes in the paper. Is that when you said it, you would send it to the state?
We'll also send a copy of it to the Mass Public Health and DEP, because of air regulations. Like
How do you send that?
there's an address.
Oh, like you mail it to them?
Yeah, they only can get it via mail, they don't, for some reason, give you online.
And then at what point does it go to the local businesses?
When it's in fact, well, you can send it anytime, but we should post it on our website,
Okay.
okay? So we'll work on with the communications committee to get the updated version out on the website.
Okay.
I recommend that it gets published on the website the same day that it's published in the newspaper.
Okay.
What was the effective date? I think we discussed 3/1, but it's not going to be until it's actually published, so that may actually be too soon. Because you have to approve it and then get it published, so if somebody can get it to the newspaper this week before Friday, it could be published by next Friday.
Oh, I see.
And then so I think you may want to make the date like the second week in March, like maybe March 15th or something, the halfway point, to give yourself enough time to get it in the paper.
That's
What do you decide?
Friday the 13th of March.
Are you making a motion to?
Have it effective March 13th.
Yeah.
Second.
All in favor?
Aye.
Aye.
Abstain. Next topic, you asked for the trash hauling regulation. I don't know what you want to talk about, because I don't have an updated draft,
I don't either.
so I haven't done anything.
Last we discussed in December, we were gonna have another public hearing.
When I thought we were going to update it because there were items in there that you couldn't agree to do.
That's right.
So you need to update the document
Yeah.
and then hold a public hearing so that the public has the document.
Yeah.
Unless you wanted
You
to
need
hold
to?
it.
So she's.
Do you want me to do it? Well, the minutes
Well, let's
from the
just-
last meeting
Can I just
reflected.
get clarification? Did you want to have a public hearing with the current document with everything in it again? Or did you want to have it?
That's fine.
Update it?
I don't care either way.
Okay. I'm not.
I just would like a more publicized public hearing for it.
Well, we did publicize it, but, I mean, what else do you want to do? We have legal things that we have to do. We have to put it in the newspaper for 2 consecutive weeks, at least 7 days before the hearing. So you gotta plan out like a whole month or so before.
I mean, I don't like the wording in it as it stands, but
I know you don't.
That's just me.
I don't particularly care for it all either, but, I mean,
So if
that-
it was
I just
on the
used the
agenda
template.
tonight, why don't we have it in front of us to be further discussing?
I don't know. I didn't ask for it to be on the agenda.
You did.
Yeah, so.
You were recused. I don't know why. you
Well,
asked
I
me to
talked
be
to
on the agenda.
ethics and she said that according to section 23B, I could be a part of it and I wanted to just move it forward. I don't understand why you're dragging your feet with it. I just
I'm not
want it to be
dragging my feet
done
with
with
it.
all
I
these
just don't have it
regulations
done.
and
It's a lot of
Last
work.
I was
so let's work on it.
aware,
Do it.
you said that you were going to amend the regulation with wording that you thought we both would agree on, and then we would hold a public hearing.
Right, but I thought that would be in the spring.
That's fine. I don't care either way.
Yeah.
I'm not in a rush to push it
What do
forward.
you think?
All right, whatever. Move on.
People have to follow the state law. There's a state law for it.
Yeah,
They already have to be permitted in town. We're covered.
Yep.
They can't have spillage coming from their trucks. It's all state law.
the whole point, but when the state sent it to us was because for the recycling grant that we get, we've been at 9 points in our grant. We get, it's like $300 or something a point. Once you have 10 points, they double that money. So it's just one of the things that they gave to the towns this year, do this regulation and we'll give you 1 more point
Mm-hmm.
and then you'll double your grant.
Mm-hmm.
And so the pursuit of it, but they want you to do it the way it was written. And
Yeah.
We can't agree on that, and
There were
I don't
specific
have any
sections that she
care
said
about-
had to
Yeah.
be in there, and I don't think that it fits our town.
I tend to agree, but I'm kind of like, it's mostly all the waste bin, but yeah, there's things changing, I haven't had time to update the document. And no matter what we do, it won't pass the grant requirements.
Right.
So if you're not gonna do it, there's no point in trying to put that forward as is, because you're not gonna vote for it, so we won't be able to get it.
Yep. Yeah, I think we have other pressing matters.
But I thought we had to have regulations
board.
for people that are applying to permits
do.
for things.
I mean, it's like,
So some mean more than others? I mean, that's not right. They're regulations, they're permits.
if you wanna tackle it and write it, you go ahead, but I'm one person, and I do a lot, and,
Okay.
yeah,
There's,
I'm. doing
I'm
the
just
best I can.
confused, like, I don't know. There's already gotta be something on the books for a regulation for the town.
I haven't been able to find it, have you?
I don't have keys to the office, so
No,
I would
it-
never be able to
it'll
look.
be like, it won't, well, if you need a key, 2 keys were made when Pam was here. I don't know what happened to them, but I'm not the key maker. I had to ask the town for a key myself. I got one, I asked, and I've asked for twice, 2 weeks in a row now, to Paul to make keys. So
thank
I don't
you.
know if he's made you keys yet. But I'm gladly gonna give you, one of you, my key. I'll take it off my keychain and drop it off with Mike tomorrow morning. And so one of you can have my key, because I could care less.
Okay.
So,
All right.
but check with Paul
Who's
on the
Paul?
key.
Okay.
Paul
I just
is-
met him the other day. He's the custodian.
He's our custodian.
Okay.
Yep. He showed me the basement so I could help
Clean it.
clear it out. That was fun.
Okay. So, to be continued on the trash hauler regulation. And I put the marijuana regulation potential amendment only because, I don't know this for sure, but on the marijuana regulation, it says that all marijuana accessories are restricted to adult-only store. And then when you remove the blunt wraps, I was told that blunt wraps would be considered under the state as a marijuana accessory. So you may want to adjust the language to reflect that, or add something to the regulation to make that distinction, so that there's not a conflicting regulation with the other regulation, right? Like, why would one be? I think it just needs clarification for that one thing, is whether blunt wraps is gonna be.
So why are you saying it like you? Like, are you no longer going to be a board member? Like, why are we just not looking at it together right now? Because it's on the agenda and.
Well, I'm trying not to say I, so, I mean, I don't know.
So say the
Why are we
board.
getting into it?
I don't know.
We,
Okay,
fine,
I'm just
whatever.
trying to clarify what you mean by
I
you.
don't know.
Like, okay.
I thought we were reorienting.
Okay.
So it's the board.
Mhm.
Yeah, but just because you're chair doesn't mean it's yours to do. So like, that's why I'm just clarifying what you mean by you.
Well,
That's all.
the last 3 years, it's been me,
Yep.
but not by choice.
Okay. Well, we're here to help you with that tonight because
Thank you.
you've made that known
Thank you.
enough.
All right, that's all I wanted to run it by. I mean, I don't have any personal feelings on it one way or another, and so maybe that's why I'm saying you, but I think with the blunt wrap change, it just needs to be clarified in the marijuana regulation.
But it already says in the marijuana I wish I had it in front of me, but the marijuana regulation already says already it's for adult shops only.
All marijuana accessories, but you're
So
not.
there's a gray area because it's,
Well,
or no,
now,
it's
well, that's what
all-
I'm saying, you guys removed the language on blunt wraps from the tobacco regulations, which banned them, right? I think you now are allowing them.
It's not,
And
it's still
not
defined.
It's not something that has to be sold in the marijuana store, like it can be sold.
I'd have to look back in
It's a
the,
tobacco
in it.
product.
I honestly don't remember.
well,
I'm
it's
just-
a,
what's
it's a
The wording
product
is.
that could be used for,
Multiple
Multiple
things. Right,
things.
that's why I'm saying, to make the distinction in the marijuana regulation that you don't intend, you're not
does it
considering.
specifically say blunt wrapper in there?
No, it says accessories, but blunt wraps are also considered an accessory, so just to alleviate any confusion or discrepancy between the two, I'm just suggesting a statement for the marijuana regulation that you don't mean blunt wraps when you talk about marijuana accessories. And then that way, it's not gonna be subject to someone's interpretation down the road.
Okay, well, why couldn't we be more productive tonight and just have that here and do that to fix that?
I'm just putting it out there, I didn't
Okay,
have time to
let's
work on it.
put it on for,
All right, the Brookfield Communications Committee Transfer Station map.
sorry, I'm stuck on your little comment. Okay, so, did you make note of that? Because my brain just forgot.
About what?
Putting that on the next agenda. Yes.
I'm sorry, who did you say said it was an accessory?
It's defined that way. If you look up online, like with marijuana accessories, I think blunt wraps is in the definition.
Okay,
So I just,
so it's kind of vague.
it's one of those
So we
things
need
that's
to
gonna
make a
fall in the
statement.
cracks. Somebody down the road is gonna, I'm just
Okay,
trying to make it so that it's easier and not as if you're lifting a restriction in the tobacco, that make sure the marijuana doesn't somehow prohibit it, like, that's all.
I respect that, yep.
Can you make sure in your very detailed minutes that you
I'm not
make,
making them minutes.
oh, really?
No, I'm not.
Okay,
Haven't agreed to anything yet.
oh, okay.
Transfer station map. The Brookfield Communications Committee was very, very kind and very diligent in working with the transfer station manager to create a transfer station map for residents that we can post online, to show them where things are at the transfer station, just to help people be more familiar with the area and where things go. So they just provided it. I think it's great.
This is very nice.
Nobody told them to do it, and they just did it, and I just thought it was really nice, so I wanted to give them a shout out, and then just get any feedback, and if you,
Muy bien.
if it's okay, we can post this online.
Fine with me.
That's very good. Thank you for taking the initiative to do this. I know other people have had questions, so this is very helpful.
Yeah,
You guys rock.
any comments on it?
I think it's wonderful.
Any,
I mean,
is anything that you, I think it's great, so anything,
I don't know if, like, the hours of operation sometimes might be helpful. I know this is a map, but when you go to the transfer station, the hours of operation posted is not correct.
really.
Yep.
I don't use the transfer station myself so much, so, but if we need to update the sign, we just ask Kyle at the highway
Oh.
when the sign guy comes and he
Okay.
can fix the sign.
Yeah.
And it's posted correctly online, but yeah, we'll have him fix the sign.
Yeah. The actual
Kyle's in
sign
charge of
there.
the signs?
Yeah, they have the sign vendor, because they do all the street signs, so he can have them update a sign, other than us having to find a sign vendor.
Are you gonna ask Kyle that, or?
Yeah, I can.
Okay.
And then, is he gonna make this a sign? Or is this just gonna go on the website?
I think it was gonna go on the website, but it would be really cool if it was a sign.
Yeah.
I don't know how big it should be or how much it will cost, but.
Even if it's just
They
laminated
make
and put
maps,
somewhere.
yeah, like
Mm,
It
places.
can also be a handout. I know he has 3 other handouts that he gives to people.
Yeah,
Oh.
so anything, yeah.
Okay. Who would make it a handout and,
I'll
Would-
just make some copies here.
and then
Here.
provide it to
Yeah.
the transfer station manager?
I've never been there, I really don't know anything about it.
It's a cool place. It's where all the cool kids hang out.
It'd be nice to be handed out when they get their stickers in August, so maybe we can get some printed up or something.
Yeah, it's far away. This is,
It's enough time, but yeah. Then people, when they get their sticker, they can have like some informational sheets with it.
I mean, if, yeah, I don't know if we need to make a motion or anything, but
I don't
I
think
can-
we need to, but I mean.
I can give some of these to Jim,
Mhm.
unless he already has them, but.
Well, yeah, you can just make some copies, we can make copies, and when Jim comes and brings the turnover, like we always give the packet back, the little money bag.
Oh,
And so you could just leave some with it and then he'll pick it
oh,
up.
nice.
Yeah.
Okay. So will you do that?
Yeah.
Okay, that'd be great. This is very helpful.
All right. Review the 12/17/25, 1/8/26, and 1/28/26 meeting minutes.
Okay. So December.
Since when do we start putting people's addresses on the minutes?
The public hearing?
The December was a public hearing? No?
Well, we always put the street, I mean, so we put that
We
number.
never
on the
do, we
street.
just put their names. I'm just curious why now.
I don't think I think I've always put their addresses. I've always put the road that they're on.
I don't think it was the exact address.
I don't know.
But December wasn't a
These
public
seem-
hearing?
It doesn't mean that it's just a public hearing.
Whatever,
but-
I don't ever remember it, okay. I just know some people are sensitive with their information being put out in the public.
So like, just looking between December and January, because they're both sitting in front of me, but, like for the publics on December, we have their first initial and last name, and then January, we have their full name.
Oh, which January?
Oh, the 28th.
So the 28th,
Oh, that's right, okay. I see that.
I did it because I just did the sign-in sheet from the public hearing. To record the public hearing, and then later in the document, when they speak, I just put their initial, unless they were written testimony, and I put the name because they weren't at the meeting,
Okay.
but because it's a public hearing. And they spoke.
So the December ones, I think we should strike on page 2 any of the, like, the personal commentary that's on there. I know it's not required by open meeting law.
You make the motion to what you're gonna strike.
Wait, are we doing them all as one, or are we doing them separate?
I was gonna do them
Oh, okay.
in order by date,
Oh,
so December. You want me to make a motion to strike it?
Well, or be specific of what you want me to do.
ML stated she wasn't gonna do the work of redrafting the document, suggested CP do it. CP objected to making the edits and felt ML was being passive aggressive. I don't think that that needs to be recorded in the minutes.
Can you strike that?
Yes.
It's after 9 o'clock.
That's the only thing I had for that one.
alright, I'll make a motion that we accept the December 17th minutes as amended.
Second?
All in favor?
Aye.
Aye.
For the next one, under number 4, you put CP asked about including Mackenzie, blah, 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 and then you said, well, and ML said that she did include a statement as her being contracted, but that for 2025, she hasn't performed much work for the town outside of sending some letters. She noted that, I guess just put who she is, because it could be, I think it's you.
Yeah.
Under number 1, in the actual substance, it just got a typo. It says LPRHC instead of LRPHC.
Oh.
Okay.
Alright, I'll make a motion that we accept the January 8th meeting minutes as amended.
Second?
Aye.
All in favor?
Aye.
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 For the next one, not everybody was listed for the public hearing, and not all these people signed in.
Sorry, what are you saying?
So like, I don't know, what was your reasoning for who you put on listed here?
I had a sign-in sheet.
So you Okay. So you,
I just want to-
okay.
Can we table this one till the next meeting,
Yes.
please? There's a lot in this one.
Are you making that motion?
Yeah, I make a motion that we
Defer to,
defer.
Second.
all in favor?
Aye.
All right.
So,
What's next?
executive session, but gotta get my thoughts here. I think we should pass over this to the next meeting, because the purpose is not stated or the reason, from what I can read here. So that goes against open meeting law. Do you want to share what it is about?
I'll add it to the next after I talk to KP.
Okay.
I just put what she told me to put. It's kind of last minute.
Okay.
Alright. You want to make a motion for that so that we have a vote?
I'll make my motion that we defer executive session to the next meeting when it can be properly written on the agenda.
Second?
All in favor?
Aye.
Aye. And back to the reorg of the board.
I'd like to make a motion that we reorganize the board and have Kim be the new chair. Since I only have a couple months left, I'm fine with staying co-chair.
We'll do that separate.
Okay.
No.
Okay.
Make a motion to make Christina the chair for the next 2 months before her.
No. Nope.
I'll second that.
Just 2 months, Christina.
No, I don't even, no. All right, yes, I will do it.
I think you have great leadership
I
skills and
appreciate
you
that.
can
Thank you.
see what you can do for the next 2 months.
All in favor?
Aye.
Aye.
No.
But you did it great.
Well, there's 2 votes, right?
It's good.
I know, I can't.
All right, I make a motion to make you sign the vice chair.
Second?
You all right with that, Kim?
Yeah.
You just have to fill in if she has to recuse herself or can't be there. Okay. All right, all in favor?
Aye.
Aye.
Abstain.
Abstain. Okay. Motion to adjourn?
Motion to adjourn 9:12.
Second?
I'm gonna make a copy for
All in favor?
Aye.
loved it, so how can I say no? Not that she didn't like hippie do, but, I don't know.